successfully complete. To all the members here who are present, I see quite a number of senior councils who are present in the House. Thank you so much for entering appearance today in this historical event. Madam Chair, I didn't actually mention, but this is historical in the sense that it is the first of its kind. And I believe 10 years, 20 years from now, it will be something that we all look back to and say, indeed, our founding fathers took the right decision. I have a simple task here. The simple task is basically to read out the statement of the Vice President. As you're following the program, you will clearly see that the Vice President of Uganda Law Society, Mr. Anthony Asimwe, was supposed to give opening remarks on behalf of the Uganda Law Society Council. Apologies from Mr. Anthony Asimwe. He had other equally pressing issues and he couldn't make it, but he assures each and everyone that he will be entering appearance in a few minutes from now, but he has given me the honors and I'll be reading the statement verbatim as it has been given to me by the Vice President of Uganda Law Society. And it goes as follows. It is my honor to contribute as the Vice President of the Uganda Law Society to this inaugural annual general meeting that is held at Protea. This moment marks an important milestone in the realization of a long-held aspiration of our society. Establishing a structured, professionally governed, and sustainable mechanism to support the health and welfare of our members. As you will all recall, the Uganda Law Society Benevolent Fund was established in July 2024 with the conviction that the well-being of the lawyers must be protected with the same seriousness and foresight that we bring to the rule of law, justice, and service to the public. While the Benevolent Fund operates as an independent entity with its own governance and mandate, the Uganda Law Society remains not only its founder, but also an active member and partner. This dual relationship reflects our commitment to strengthening the safety nets that underpin the dignity of our profession. In its first year, the fund has successfully laid the necessary foundations for its long-term sustainability, including the establishment of key governance structures, development of policies, and operational systems and initiations for the welfare and healthcare support to the members facing illnesses and vulnerability. These early milestones affirm the important role of the fund that it will continue to play in supporting lawyers throughout their professional journey and retirement. As the Uganda Law Society, we are particularly encouraged by the Benevolent Fund's commitment to transparency, accountability, and member-centered service, values that are essential for building trust and ensuring that this institution grows from strength to strength. We also recognize the collaborative efforts between the Uganda Law Society Secretariat and the Uganda Law Society Benevolent Fund in alignment with the financial flows, members' contributions, and reporting frameworks. This partnership will be crucial as the fund advances its strategic planning and policy development for the year and for the years ahead. On behalf of the Uganda Law Society, I extend our appreciation to the Board of Directors of the ULS Benevolent Fund, the Secretariat, and all members whose dedication has brought the fund to this promising beginning. We remain fully committed to support the fund's growth, strengthening our shared governance relationships, and ensuring that the well-being of every lawyer in Uganda remains a central priority. We celebrate this first AGM, and we look forward to a future in which the fund stands as a strong, transparent, and compassionate pillar of support for the entire fraternity. Thank you so much for listening to me. I've been given another task by my colleague, Madame Barbara, to take the honors, to invite a senior counsel, the Attorney General of the Republic of Uganda, represented by the Director of Legal and Advisory Services, Mr. John Bosco Souza, to come and make his opening remarks.
Thank you very much. Members, Chair of the Healthcare Benevolent Fund of the Uganda Law Society. I will adopt the protocol that has been laid out by the previous speakers. And first of all, thank you for the invitation extended to the Office of the Attorney General in person, to attend this meeting, and also to convey the apologies of the Honorable Attorney General, who has not been able to attend because today is Cabinet Day. But he told me specifically to let you know that he would have loved to attend personally, and probably will attend the next meeting. On his behalf, I would like to congratulate the chairperson and the members on making 1 year, and on the achievements that I've just seen in the report in this short time. We are grateful for what you have done for the society, and would like to restate our support to this fund, both as individual members of the society, but also as an office, and to pledge to lend whatever support we shall be able to lend going forward. We were present when this fund was launched, and we like to add our voice to those who thanked the leadership of the Law Society at the time this idea was conceived, and who saw it through. We thank you, ex-President Bernard Oundo, and your team. Members and colleagues, we know how this came about, the circumstances. COVID was an experience that no society was really prepared for, including the Uganda Law Society. And we recall what our members went through at an individual level, and the concern that the Law Society leadership at the time had concerning the well-being and welfare of the members who were not able to cope with the circumstances of the time. We are happy and grateful that the decision was taken to establish this fund, and we have no doubt that it will help members go forward. We also have no doubt that with the able leadership that the fund has, it will continue to grow. Again, we can only pledge to support the fund and the Law Society in this project. It is still a project, I think. And we shall be present as and when we are needed. And in case you need us to be your spokespersons before any forum anywhere, we shall be available and ready to lend a hand. Thank you so much.
Thank you so much, Honorable Attorney General. Honorable Attorney General, maybe before you resume your seat, would like you to welcome our keynote speaker.
Thank you so much, MC, for the day. It is my honor and privilege on behalf of all of you to invite the keynote speaker for this morning to come and address the meeting. Thank you very much.
Thank you so much. Thank you so much, distinguished members. Thank you so much, Honorable Attorney General, for your remarks and your commitment to support the Uganda Law Society Healthcare and Benevolent Fund. While we set up our speaker who is going to make his speech online, allow me to invite Mr. Munabi to provide for us a brief about our keynote speaker. Thank you.
Thank you very much. The keynote speaker is the chairperson of the Advocates Benevolent Association of Kenya. It's the association with which we did benchmark to have this project started and running. Byron Menezes is an advocate of the Kenya High Court. He is he serves on different committees in the East African Law Society and the LSK. He is serving as the current chairperson of the ABA for 2025, 2026, 2027, I think. He's joining us shortly. I think that's the little I can say about him. But the IT team is confirming his
Thank you, Philip. I don't know if my camera has been enabled. It's on my side.
Sir, it's being enabled. You're most welcome, sir. Okay, could we have a music interlude as we ensure that we project our keynote speaker? Thank you. Mr. Menezes, is it possible to enable your camera?
My camera is on.
Ladies and gentlemen, we apologize for the glitch, but we're just finalizing it and we get on air. Thank you so much, our distinguished guests. And in this digital era, we are now being challenged by technology. And indeed, very many people are asking that, should we really totally eliminate the human factor? Because technology does have its challenges. But as we fix that, please allow me to invite our chairperson, Mrs. Lydia Ochengobo, to give us a brief about the Uganda Law Society Healthcare and Benevolent Fund. Thank you.
In my other life, we have a saying that when they give you lemons, you make lemonade. So let us try to fill this gap with some useful information by me reading the foreword and my remarks, which are presented in the annual report, which I think are also pertinent, and so that we can catch up with time. I again stand on the protocols already established. My name's Lydia Ochengobo Proscovia. I don't use the name Proscovia, but I just want to those who don't know that name. It is with great honor and a deep sense of responsibility that I present the first, of course, this is going to be our report that will present the first annual general meeting to you members, and at which we're going to give our accountability. This inaugural report marks an important milestone in the journey. We began with a background analysis in 2023, which culminated in establishing a dedicated institution to safeguard the health, welfare, and dignity of members of the legal profession in July 2024. Over the past year, our focus has been on laying a firm foundation for the ULS HBF governance, operations, and strategic direction. As a new entity, we prioritize establishing systems, building structures, defining policies, and setting the tone for accountability and member-centered service. We also initiated collaborative engagements with the Uganda Law Society, as you have heard from the President, to streamline contributions, enhance transparency, and ensure alignment with the ULS HBF's objectives. We acknowledge support from the ULS Council, the Secretariat, and the entire membership accorded to the fund from the very start, providing it with free office space and a conducive working environment, which has helped cement further the symbiotic relationship between our two institutions. We thought of what to do when we establish ourselves. What do we do? Where do we go? So when the ULS Council agreed to give us space in the building, in the new building, it was a breath of fresh air because it has saved us what would have gone in rent. the amount of money we would have spent in rent, we are using it too. So we're going to use it to support the members. Although we are at the beginning of our journey, the demand for healthcare and welfare support has already demonstrated the critical need for the fund. We responded to emerging cases of illness, bereavement, and vulnerability among our members. And those are quite challenging. We keep on learning as we go along. We have got members who have suffered different types of challenges, accidents. Some people have been attacked by thieves, inflicting on them life-threatening injuries, and they have ended up in hospital for surgery. People are afflicted with cancer and other debilitating illnesses, but also we have got mental health issues, and that is a critical area. And amidst us, we have got people who are going to be able to help us triangulate those issues, and they have been supporting us in that area. So as we craft mechanisms for support lawyers, it's not only in moments of crisis, but across their active and retired years. We want to have a healthy lawyer throughout, not just when they are sick, not just, but throughout our lives. So what are we talking about? We want to have people who live healthy lives and have healthy lifestyles. We sit a lot in our offices. We need to, every time, we need to start getting up and walking deliberately. In your office, get up and walk. You see me here with my crutches. Now I'm learning how to walk again after 6 weeks of since I got the injury. So as you see me here, it's part of the healing. It's part of the exercise that we are advocating for. This first year has not been without challenges. As with any new institution, we encountered operational, financial, and administrative hurdles. However, these challenges have provided valuable lessons that will inform the development of our long-term strategic plan, and that is the ongoing work on the 2025, 2026, 2027, 2028 strategic plan is already underway. And we are also working on the policy frameworks for healthcare, benevolence, and welfare, which will guide us toward a resilient, forward-looking fund. So sooner or later, we shall call you once again to affirm and adopt the strategic plan, not very far from now. So I extend my sincere appreciation to our tireless fund liaison officer. Sandra, can you please stand up for recognition? That lady has walked, and I don't know how many miles she has walked and how many times she has been to some of your offices. My colleagues on the board, okay? The colleagues on the board, the ULS leadership, thank you very, very much. Our past presidents here present, those who really laid the road, they laid the road for us to start this organization. It will be remiss of me not to mention the support of the Attorney General and all other members that have supported us in this journey. Your commitment and trust have been essential in enabling us to take these foundational steps. As we convene today on our first annual general meeting, we do so with optimism and a shared resolve to build a strong, transparent, and sustainable ULS HBF that serves the profession with integrity, compassion, and foresight. We look forward to working together to shape a future in which every lawyer in Uganda is supported, protected, and cared for. I thank you.
Thank you so much, Chair. Thank you so much, Chair, for your leadership. And now, ladies and gentlemen, our speaker is online, and I would kindly request that our media team projects him and he starts his presentation. So we apologize for the glitch, and dear members, we apologize for the glitch, and we are ready to receive our keynote.
Good morning. So good morning to the representatives of the President of the Uganda Law Society, representatives of our distinguished advocates of the bar, our senior counsels, ladies and gentlemen. I would be amiss not to say that it's good to hear my friend Mr. Benevolent, the former president or CEO, and of course other colleagues I see online. But let me take this opportunity. It's a privilege to address this assembly of the Uganda Law Society. As members of the East, we share a common heritage, a common dedication to the rule of law, and crucially, a common understanding of professional and personal pressures an advocate. I want to commend of course, the ULS for the significant and you have already taken with the launch of the healthcare demonstration of solidarity. As ABA, we are extremely grateful to share our regional blueprint for success and sustainability. Certainly, it is something that binds us universally across the country, across the East African region, across Africa, and across the world as advocates. I will turn very briefly to the pillars, advocates, benevolent in Kenya, and then move on to the presentation we prepared for you. The technology team, perhaps you can start slide sharing my presentation. I think as we wait for the tech team to share the slide, the Advocates Benevolent Association, as I may have mentioned earlier, is the welfare arm of the Law Society. We are based at Gitanga Road, the same headquarters where the LSK is housed. And we are essentially an integral part of the Law Society. For many years, ABA has been perhaps very centrally based in the sense that all the board members for the last 10 or 15 years have always been based out of Nairobi. And for those of us who live outside the capital city, the services and programs of the Advocates Benevolent Association have tended to be something that is a mirage. And as the new board that came in last year, in 2024, one of the two key pillars we had at the time was, number one, sensitization of ABA programs to advocates across the country. And this meant that we had to indulge in extremely heavy sensitization programs through webinars and ensuring we engage at events across the country. Over the course of the year, we signed partnerships with medical hospitals, which we then utilized to bring to the events for the various LSK chapters and branches across the country. I can see our slide is about to start. Thank you, Tech. We can move to our next slide. So this is the statutory foundation. It is definitely association. We pay a token of last expenses. We support the education of children. And we do everything incidental or conducive to the attainment of all or any of the foregoing objects and towards the advancements of members' welfare. Next slide. The current constitution of the board is 7 members. This is the current board. So I serve as chairperson. Next slide, please. This is the current board on the screen in front of you. Ms. Frida Chepkoech Lotuya is my treasurer. And then the board members comprise of Ms. Deborah Juang, Ms. Elna Wambua, the current Law Society of Kenya president, Ms. Faith Moni Odhiambo, the current vice president of the Law Society, Mr. Moara Kabata, and the CEO of the Law Society and the Advocates Benevolent Association, Ms. Florence Muturi. Next slide, please. Next slide, please. With regard to the role of the board, our key mandate is the investment of the funds that are collected. The funds are collected through the Law Society and then split between the Law Society and the Advocates Benevolent Association on a set formula. We also have a secretariat which is based at Gitanga Road, which is again the Law Society headquarters. We currently have 3 staff members, a program officer, a program assistant, and an office assistant. And this is headed by the CEO. Next slide, please. So our membership consists of basically every advocate in Kenya who is an active member of the Law Society. Next slide, the slide on our membership. And currently those are our figures. We have 1,814 life members and over 20,000 annual members. And of course, we had a cohort admitted last week, which is about 900. They will already be joining us as some of them take out their PCs. Next slide. So with regard to membership, the standard membership per year, if indeed you would like to constitute yourself as a life member, you would then pay 150,000 as a one-off, and then you remain a life member for the rest of your life. And this would mean even if you transition to the judiciary, the office of the DPP, the office of the AG, you travel abroad, or you become inactive in practice, you will remain a life member. With regard to the annual subscription at Router to ensure you can access our first crucial program in place, and again, our biggest outflow in terms of funds, is educational assistance for children aged between 4 years and 23 years at the time of application. We pay school fees at the current maximum limits as listed. For nursery school, it's 55,000 Kenya shillings per student per academic year. Primary school is 80,000 shillings per student per academic year. Next slide, please. For secondary school, we pay 80,000 shillings per student per academic year. For tertiary education and universities, we pay up to 100,000 shillings per year. And indeed, if the child wants to follow their career path of their parents, we will pay the entire school fees at the Kenya School of Law. Currently, this totals to 190,000 Kenya shillings. At the end of the financial year in 2024, we had the listed numbers on the screen. I can tell you at the moment we have passed 330 children already. The total as of the end of 31st December 2024 was 23,758,049 shillings. That's per year. 23 million shillings is what we pay out with regard to the children of advocates. Do not tell their spouses or their dependents about this program. I leave it to you to explain why, but we continue to do as much sensitization as possible to ensure that everyone is aware. And we continuously encourage advocates to inform their dependents that in the event that something does happen to them, please let their family know there is a safety net with regard to education. Thank you. Next screen, please. Our next program is the medical assistance benefit. This is a one-off payment of 150,000 Kenya shillings, which we pay towards the medical bills of an advocate who is an active practitioner. This used to be very restricted. In 2023, the board only served 6 members. When we came in as a board, we realized that it was important to assist members a lot more. We have now expanded it to cover maternity, substance abuse, alcohol addiction, and any sort of rehab that is inpatient. So what needs to happen is basically the member will contact us. We will check their status that they are active or a life member. They will then send us the invoice for the hospital and the payment details, and we pay direct to the hospital. There is no reimbursement. Currently, the payment is 150,000 Kenya shillings towards the medical bill. This can be utilized partially or in full at one time. It can be used in partnership with your insurance or our own national health insurance scheme called SHA and SHIF. Again, the issue of sensitization has been a constant issue, and sometimes we receive requests after, or indeed, perhaps the family do not know that this particular benefit is available, informing their families and dependents on this benefit. The medical assistance for the year ended is displayed at the bottom of the screen. Last year, we paid out 1,939,000 to members for medical assistance. Next screen. Our third program is the last expense benefit. This is capped at 80,000 for annual members and 100,000. The payment is made to the deceased member's next of kin, which is indicated when you take out your practicing certificate. The total we paid out last year, sadly, is 2 million. An area where, again, due diligence comes in. We are in the process of reviewing our ABA rules. They are horrible, archaic, and unconstitutional. And again, as a board, as we came in, we indicated that we're in alignment with the Constitution and a reflection of our membership. Next slide, please. We have a pension scheme. It is run in conjunction with ICEA Lion and Britam. The membership is voluntary, and it provides members with an easy and convenient way to plan and save for their retirement. This is a key pillar of mine that I've been pushing as hard as possible. There are over 70% of our demographic in Kenya today. They start their investment journey as early as possible. I think in our research and across the world, advocates are known for alcohol and being workaholics. And the issue of personal investment tends to come a distant third. So we have really tried over the last year or so to ensure that our members start the investment journey. We have financial specialists who do monthly webinars for us. We had one last week from the Capital Markets Authority to enlighten members on how to invest in the narrow procedures. This week, I have a financial consultant also doing a webinar, again, on how to invest as a young advocate and what are the best options in terms of returns, in terms of a long-term objective, a short-term objective, and so on and so forth. I think we would all agree that the most distressing we see is one of our seniors who has now fallen on difficult times. It is an extremely distressing sight, especially for a profession that prides itself on dignity and nobility. Thank you. Next slide, please. Next slide, please. Again, I mentioned earlier about universal continues to be I personally meeting with fellow colleagues. For many of us who started practice before the virtual court came in. We picked up practice tips on the benches. We also had the opportunity of meeting seniors and asking for advice and information and receive some counseling from them in those sessions when we went for tea or lunch with them. Unfortunately, that era is now gone, especially in Kenya. We are almost fully virtual. And the consequence of this is that the issues of mental health continue to rise with alarming regularity. And in respect of this, we now signed a partnership with Amani Counseling Center and Training Institute. They are based across the country. They provide psychological and counseling services to our members. And as the Board of Management, we pay for the first 2 individual therapy sessions. Thereafter, members pay for the services they request after that. It's my personal opinion that we will face a pandemic with regard to the issue of mental health because we have transitioned into the virtual world. We no longer meet, we no longer have colleagues we can call for assistance. I can tell you at the Kenya School of Law now there are 3 options. You can attend physically, you can attend virtually during the week, or you can attend virtually on the weekends. Again, this continues. Colleagues or cluster families, the costs of the counseling. These are discounted costs to ensure at least our members get some sort of benefit from our partnership. We've done the individual counseling, which of course we pay for the 2 sessions. We have group counseling. This is essentially for big law firms who are willing to do this. And of course, we are cognizant of the issue of family. Hence, we have an option on family therapy. And the Amani Counseling also do customized programs for law firms, for team building, and any other type of counseling that is required by bigger law firms or bigger organizations. Next slide, please. In recognition of we signed an MOU AMREF. This is to ensure that an advocate or his family are able to receive medical evacuation in case of a medical emergency. In Kenya, most of students, they could access excellent healthcare, and of course, to ensure that also their families would have this option as well. Hence, we signed an MOU with AMREF. I believe the next slide shows we have available to our members. These are all discounted for advocates. If you could move the next slide. Have as an advocate, they are discounted and these benefits. It also covers the advocate himself, or indeed if they choose their extended family. Next slide. Over the course of the year, we also realized that it was extremely important that we continue to extend partnerships and services and programs to our members. We then signed with Mega Health Insurance Brokers. They are an agency. They provide insurance cover for health, for life, for education, for our members. So all you have to do is call them up, indicate to them what you would like, and they will then search all the insurance companies and provide of our eyesight and the fact that we are now stuck in front of screens. I negotiated an MOU with Bowes Optical. They're an optician company based around the country. As an advocate now, if you walk into Bowes Optical in Kenya, you receive a 10% discount. You get free eye tests. You get free eyeglasses over 45. They also attend all our LSK events in the various regions around the country to give medical eye checkups. They're a valued partnership, and we are grateful for them for engaging with us. We further then, we also engaged with hotels across the country. This list is very outdated. We currently have over 25 hotels that are now in partnerships with us. As an advocate, you are traveling across the country and you walk into any of these hotels, you can produce your advocate's card and you will be entitled to a discount. We have tried to ensure that we have hotels in every major town and city across the country. So in the times of, indeed, when we do close our offices, which is hopefully next Friday, that advocates can then choose to de-stress and detoxify their lives by going on holiday in different parts of the country. We further have a partnership with a large organization called Pathcare Laboratories. They have laboratories across the country. As an advocate, if you need to do medical tests, you will walk into Pathcare Laboratories, produce your LSK card, and you will be able to do the medical tests at a discount. Further to that, we ensure that we have monthly webinars on a wide range of topics. This covers financial literacy. Indeed, last Friday, I signed an MOU with Absa Bank. We are now rolling out a program for financial literacy for young advocates and, of course, across the country to ensure that we start the process of investment at a very early stage. The webinars also touch on issues such as fibroids, dealing with grief, mental health, dealing with cancer. And we continue to try and find innovative ways of engaging with members. This year, we held for the first time an emotional and wellness program day at Gitanga Road in Nairobi. We had the services of a personal trainer, a yoga instructor, and we had other partners from Bowes Optical, Equity Afia, who's a medical provider, AMREF, and other partners who came along. So members had the opportunity of going through training sessions, personal training sessions, exercise, as well as yoga sessions, and then having their medical checkup, their eyes tested, and then, of course, access and have discussions with insurance partners that came on the particular day. We also realized the need to transition to the digital era. We set up ABA on the social media platforms. I believe that's the next slide. So we are on LinkedIn, we are on Twitter, and we are on Facebook. And this continues to be a journey to ensure all our members are available and they know the services that we offer. We also have a WhatsApp channel where we post on a daily basis all our services and programs, especially our contacts, to ensure that we take perhaps the poor sister of the LSK to where it should be, which is, at least in my opinion, an integral part of the profession. In Kenya, mental health, the stress of the profession continue to be enormous challenges. And the quicker ABA now sits at the center of this with the Law Society, the better it would be for all of us. One of the challenges we have in 2023, the previous board paid out 13 million shillings to members. In our first year of 2024, we paid out 27 million shillings. That is an increase of more than 100%. In 2025, we've already gone past 31 million shillings in benefits to our members. The reality, however, is that now that ABA is alive and well, and members are aware that there are benefits for them, at some stage we will have to consider as a society the issue of contributions. I engaged with the Rwanda Bar. I am aware that they pay, I think, about 57,000 Kenya shillings each year for health insurance and their practicing license. At some point, perhaps that's something the different bars may have to consider in terms of services to members. One of the other challenges we have had is making priorities and making choices. In Kenya, we call them mizingas. Do you buy a bottle of black label first before you buy your insurance policy? Which takes precedent? Distinguished colleagues, at this juncture, I think I've taken up a lot of your time. I hope I have conveyed the experience of the Kenyan Advocates Benevolent Association, and indeed confirmed that a professional society is only as strong as its weakest member. By institutionalizing and sustaining a fund, we are not just offering charity to our members, but most crucially, we are upholding the dignity of the entire legal profession. And in this regard, I refer to ensure that every advocate and their loved ones will not be left destitute. So I urge the members of the Uganda Law Society to support the ULS Fund and ensure the issues of due diligence, of communication and preparedness are key to ensure that certainly for our lives and the lives of our dependents, that there's a lifeline readily accessible when the day of need comes. And with those few remarks, I thank you very much for this opportunity. I am extremely humbled and I'm extremely grateful for this opportunity to speak to you. Thank you.
So much, Mr. Menezes. A round of applause, another round of applause for Mr. Menezes. Thank you so much, sir, for empowering us with knowledge about the Kenya experience, since your fund has been in existence for a very long time. And at this juncture, allow me to invite a panel to carry on with references and discussions following your communication. Allow me to invite Senior Counsel Bernard Owundo to our panel. Counsel, we welcome you. Thank you for joining us, and thank you for implementing the members first at that time to bring this on board. Our next panelist is Dr. Ekochu Elizabeth. Dr. Ekochu Elizabeth is a medical doctor, and she's a board member of the fund, of the Uganda Benevolent Fund. And the third panelist is CFA, CAIA, CIMP, Alan Norman Luetabe. As you can see from his credentials, he's a finance guru. So thank you to our dear panel. And once again, thank you so much to our keynote speaker. I would just like to start us off by commencing with Dr. Elizabeth. Dr. Elizabeth, could you kindly guide us on your reflections from the keynote address in relation to the Uganda Law Society Healthcare and Benevolent Fund in terms of health and medical aspects?
First of all, let me also join my voice to really thank the chair of the Benevolent Association of Kenya, because he has helped us to dream, and we continue to learn so much from the ABA of Kenya. Thank you so much, Mr. Menezes. I will not go into protocol. I'll just stand on the protocol that was given earlier, established earlier, and just make some quick remarks on what I gathered from him. First, from an overall perspective of what can be done, what I saw is that the ABA has touched on the four main areas which you can touch in trying to address or provide products from a benevolent fund. One, you can provide medical related initiatives. They have done that. But note that that is one of those which was a little bit restricted. They had only 6 members until recently who had benefited from this area, which means it's one of those which they found difficult probably to initiate because of the complexity and the need to have very clear policy guidelines. On our part, that is an area we have started on as well. And we've established some policy guidelines on how our members can access medical assistance for critical illness only. We actually have a list of critical illnesses which we believe should be the first list. Of course, it's open to more discussion subject to what we see is happening. And we're going to post it on the website so that everybody will know what's the procedure of accessing and also what illnesses are we talking about. Because many of us can get malaria and be admitted for one day, but maybe will not provide assistance for that. He has also, the other area, of course, in medical assistance, we can, apart from giving medical assistance for inpatient hospitalization, we can do preventive health programs where you have annual health checks and things like that. And I saw that the Kenyan counterparts have already started on that. And that's a possibility also for us. They also have done emergency medical care, where they now have partnered with AMREF to do evacuations. That's a very long-term dream on our side because that requires a lot of money. I've had a chance to help in the evacuation of patients from Uganda to Kenya, and it's quite costly. They've also done, partnered with some insurance companies and contributed towards coverage of some of their members. And that's something we've also thought about. We actually had UAP come and talk to us about some of their products. But we realized, number one, we need to have a full and complete list of all our members. You cannot do any insurance or support for anybody without knowing who is eligible for support. So we have some homework to do there first. Then we also, the other big area is benevolent and welfare initiatives, which they have mastered in almost. The bereavement support, which includes education support to the bereaved families' children. We are still far from that. That's their biggest, but we are not yet there until we know our members in detail. Education grants, hardship assistance. Those are all areas which we want to think about as we grow. Wellness and lifestyle initiatives, we have started those. We started a few wellness program, I think monthly programs, which were airing using the ULS Zoom link. And they were quite interesting, actually. People were interested in them. But then we had to think twice because there are some of them I think there was feedback that we need to streamline them so that we don't interrupt the R&B their timetable, and we liaise with them very well. So that's something that we are going to work on this coming year, that we make sure that we have programs which are well aligned with the ULS and which we can do together actually. So that's a big dream. Fitness and nutrition programs. Yes, this is one area we've already started talking with a few fitness gyms and all that kind of thing to see how we can subsidize for members and maybe different age groups of members, because the elderly may not be feeling that we can join the younger group of Council Philip and all who can do a marathon, whereas we can do gentler exercise but still encourage people to do things like that. Lastly, work balance activities, mindfulness sessions. We actually had a session where we had Madame Lindsay here come and talk to us about stress at work. And those are the kind of things that we want to grow a little bit more, because I think we need to do a lot more prevention than crisis management, which is good. And then the last tenet is community and social support, which have actually been happening even before the Benevolent Fund, drives where we fundraise for members and that kind of thing. And we'll explore that as we grow as well. Thank you so much. I think those are my quick remarks, but we have a lot to learn from our counterparts. You know, they've been there for 50 years or so. We've been there for 1 year. And the fact that we are actually doing something even now, I think we can give ourselves a little pat on the back. Thank you so much.
Thank you so much, Dr. Elizabeth, for sharing with us those insights. Ladies and gentlemen, we've been joined by Ms. Lindsay Kinkuhaire on the panel. Thank you for joining us, Ms. Lindsay. And I would just like her to loop into that. She is a counseling psychologist, and so would like her to guide us on the emotional and the mental aspects in relation to the presentation that has been made and the outlook for us here. Thank you so much. Briefly, we're pressed for time.
Thank you. Good morning. All protocol observed. So this is really a perfect day for discussing mental health. Why? Because it's a kind of relaxed day. It's a breakfast engagement. As you have an AGM. So your minds are maybe slightly off the usual grind of your daily activities. And we can hope that we can insert in this program something to kind of take you away and reboot or kind of rearrange your minds and your mindset in order to think about mental health and its importance to us. We are all born with perfect mental health. And then over time, it becomes a continuum. So you are from a perfect mental health when you're born, and then things happen over time. And then there are times when that continuum goes to the other end of the spectrum, which is the mental illness or mental disorders. And what causes that? In your profession, it's obvious, the stress and the kind of high charged atmosphere that you are dealing with all the time. So it's very hard to take off time and realize you are only human and your mind can only cope with so much at any one point. So one of the things I'm really pleased about is that you have already started to approach this as in your humane or human capacity, because when we go into the areas of profession, we sometimes forget that we're human. It's about achievement. It's about making sure that the deadlines are met, and then you forget that you need to take some time off to kind of recalibrate yourself. In fact, research has shown that in the legal profession, you are higher than average in terms of mental health challenges because of the nature of your work. So I think it's important to realize that this is what you are dealing with. Someone said, did a research and called it the unmentionable and the undeniable. This is about the legal profession. You deal with things which you have to deal with, and you can't mention them on a daily basis, and you can actually not even share with anybody. Then you deal with people's issues, people's very highly important issues, and you have to be able to cope with them. And it's very hard to make a stop on that one and do your own life, your own personal life. And then there's another research that was titled The Silent Struggle. So this really speaks to you directly, There was also something that was mentioned by the keynote speaker about addiction, about alcohol and drugs. And I want to mention one thing that is happening in our space now is that when you go out for a night, you have to to relax, and you have your drink, or you have whatever it is you take, and you realize it's morning, and you have something to do in the morning, and then you go to this person who is a medical profession that will give you some kind of treatment, which is really electrolytes and things to boost you up and to detox you. And then you are up and running, and you go for your case, or for your courtroom. Now, this is a really dynamite waiting to explode. And I thought I should mention that and say that instead of that, let's focus on the day-to-day things that we can do that will help us to be able to cope with the pressures of work. And just two quick things that I thought I should mention. Regulate your nervous system. Your nervous system is highly charged all the time. So even when you don't need to go to the bathroom, go to the bathroom, take a short break, and come back and do whatever it is that you need to do. Then one of the things is taking home. So how do you transit from work to home? Create a space where whether it is debriefing, whether it is something that you do in between the two spaces. And then the other one is boundaries. I know with lawyers, you have to, to get all these cases. When do you say no? When do you say, I'll respond tomorrow? When do you say, no, I cannot do this today for you? When do you say that? You need to develop a culture where you can actually say some of these specific things at the appropriate time. And then what is your life outside the law? What does it look like? I hope maybe later on we can say something little about that. I better stop now.
Thank you so much, Ms. Lindsay, for the insightful information. Ladies and gentlemen, I'll not stand in between you and your wellness and your health. So there's a breakfast is served, and it will be a working breakfast. But also just to let you know that we have some members online who would like to ask questions to the keynote speaker. Please keep your questions coming. We will address them at the end of this session. So please, ladies and gentlemen, there is breakfast. You can walk out, pick your tea, and we continue. Now carrying on to the money issues, and I know many people say that lawyers and money. And so we would like to invite at this juncture, Mr. Retawe, to guide us through the financial aspects. What are your reflections? What are your thoughts about the financial aspects in relation to the Uganda Law Society Healthcare and Benevolent Fund and the communication that has come through from our guest speaker?
Good morning. Morning once again. It's a pleasure to be here, showcasing alongside my fellow board members the task that we were given almost 15 months ago to create from scratch a healthcare and benevolent fund. I recall when I was given a call by my good friend Bernard, I thought it was a small task. I thought I was going to come in, one meeting, we direct, I show my fellow board members where to go, and then the matter will be closed. That was a big lie on myself, because as we started, a lot of issues started coming out. Some were issues at formation. When we went to one bank to even register an account, we were asked, show us evidence that the members have authorized you. And each member should have signed off on that authorization. At that time, I knew we were going to have a very big challenge for the next couple of months. But now, reflecting after these 15 months, we have figured out what to do. I had to assume some roles as management, doubling as a board member as well, to be able to get some decisions done and taken care of. And I'm very happy that now that I'm looking back, it happened the way it did, because it has allowed us to spend less funds on outsourcing the management of funds. So that is being done in-house. And we are building our capabilities gradually. But for me, the most pressing matter is that as I've observed the growth of the Benevolent Fund over the last 15 months, I see that there is a very big need to support over 4,000, 5,000 members. Some are very young, some are at different stages of life. But the need requires significant funds. As there is more awareness about the Healthcare and Benevolent Fund, we are going to get a lot of pressure. And this pressure is going to translate into a need for funds. So at the back of my mind, I recognize that it's going to be very important for us to grow this fund very fast. So the actions we took this year was to buy some bonds. We invested up to 800 million, I believe, and we are likely to generate at least 150 million per year for the next 20 years from just this initial investment. My vision is that each year we should be able to generate at least 300 million. That will be able to take care of events like these, awareness. We should be able to send you to see Madame Lindsay at a discount, and we should be able now to bring on board more benefits. When I looked at the presentation from our colleagues at LSK, the education assistance program really piqued my mind. When I look at our membership, the majority are below the age of 42, and they still have young families. So this is a product that will resonate. But when I look at how much they have spent, 23 million Kenya shillings, I had to stop and stutter mentally. Where am I going to raise 23 million Kenya shillings to cover these children? But it is something that is important to think about. But where are we going? I think it's timely in terms of the decisions that we are taking to start. I know some people will say we should have started 30 years ago because Kenya is 60 years. But yesterday is still a good time. We have started, we have 4,000 members. We have good areas where we can place your funds and they can generate good investment income for us. But there are even other areas we have not started to explore. At the back of my mind, for me, when I look at your membership, many of our members are going to be starting their own farms. They will be needing financial support to run their enterprises. At the back of my mind, I see the Benevolent Fund, from an investment point of view, as also a likely source of capital into our members' business as we recycle and grow. So we grow and create programs that help you on the healthcare and benevolent side, but at the same time, these funds, when they are good and they are large, can also be a source of capital that we can place back in some of your emerging companies. So there is a lot we can start dreaming about. Working together, we can build a lot more
support, we can build an ecosystem that does on the healthcare and benevolent side supports us, but also these funds can be invested even in some of our memberships activities to generate income for ourselves. But the most important conversation I've had today, and I'll share this last, is about the retirement benefit scheme. It's a question that we are grappling with across many other sectors. At a government level, I've been involved in a conversation how to create an informal sector social security platform or fund for the people in the marketplaces and the border people in the gig economy. But we also recognize that there are other individuals that are not adequately covered. And I share this because I used to work for Bank of Uganda many years ago. It's about 5 years now. But in Bank of Uganda, what we noted was Bank of Uganda has its own scheme. At retirement, the money generated from that scheme could only replace 1/3 of your last salary. And BOU was very generous in its design. However, even at the very end, even the most senior person, a director, an executive director, when they would retire, they will retire with 1/3 of their last salary. So think about it. Somebody has been living a life of about 15 million, 20 million per month for 20 years or 15 years. And now you are asking them to go live a life of 5 million for another 25 years in retirement. That is the real problem with retirement planning. If we don't think about it adequately, you are moving from a very high life and dramatically you are moving to a low life. How do we design replacement income? This is, for me, what piqued my mind when I saw what our colleagues have done. For many of our members in the legal fraternity, you are in the private sector. And so you'll be running your own firms for about 30 years. But regardless whether you're private or public, there will come a time when you have to retire and exit. And this problem will present itself. We can, and I believe the Benevolent Fund then has an opportunity to create an additional retirement benefit scheme for the legal fraternity. Complement what we are doing with the National Social Security Fund, because at the back of our minds, we should know that the money we have with NSSF will ultimately be only 1/3 of what you need. And so there's need for an alternative, another secondary scheme to bring you to at least 2/3 of your last level of earnings. So for me, what I see for where we can go is that we have started well. We have designed a very good structure, very stable. We are expecting to introduce some additional programs next year. These can easily be managed as we grow our funds. But the biggest support we can add is also starting to think about how you will retire and how that retirement could look like. And so perhaps, and I'll pose this to my fellow board members, that perhaps it's time for us also to think about creation of a retirement benefit scheme now, because in 20, 30 years' time, it should be the one supporting the 60% of our members as they transition to a life after work. So I'll pause here. Those really for me are the key points I picked out. And I'm able to share with you my thoughts on the economy, but those can also come at a later time. Thank you very much for listening to us. And I hope from what we have shared in the notes, you're able to see the amount of work that has gone in creating the Healthcare and Benevolent Fund. Very excited for what 2026 brings. And the ideas we have seen from Kenya give us a starting point as we brainstorm to create a better healthcare and benevolent fund for our legal fraternity. Thank you very much.
Thank you so much, Mr. Luetebe, for the insight that you've given us in the financial aspect. And now, ladies and gentlemen, allow me welcome Senior Counsel Bernard Owundo. Senior Counsel Bernard Owundo is the vision bearer and he's the midwife of the Uganda Law Society Healthcare and Benevolent Fund. And so would like to pick his mind on the futuristic aspects of the fund and what his reflections are. Senior Counsel.
Thank you. Thank you so much. Allow me stand. Because rarely do I get an opportunity. So just allow me stand so that I can be able to. First, members, I think, let me first thank Byron. Thank you so much for the excellent presentation. I think it's important to say that thank you for the inspiration. And for members here, yes, we can. We can. We can. I want you to believe that we can and we can. Because I just want you to reflect on the numbers. And I thought my good friend had just peeped at my notes. In 1 year, members, in 1 year, the Uganda Law Society Healthcare and Benevolent Fund will raise 150 million. Let me say that again. It will raise 150 million Uganda shillings. For the next 20 years, the Uganda Law Society Healthcare and Benevolent Fund will be raising 150 million Uganda shillings. So for per year, that is per year. So for 10 years or for 20 years, you're talking about 3 billion Uganda shillings. And that means that we are not even reinvesting what we have. If we also reinvested what we have, we would almost have almost 4 to 5 billion Uganda shillings. Byron touched on the issue of sustainability. There are 20,000 members in Kenya Law Society. They are contributing 600 million Uganda shillings. I did the math quickly because they are doing 23 million Kenya shillings, which is about 600 million Uganda shillings a year to sustain their membership. For us in 1 year, we are doing 150 million Uganda shillings for 5,000 members. I don't know that you can picture that. I don't know. I hope you can picture what we are talking about here, about the potential of this fund. I think if you look at the numbers, and where we are going, and this is where I thought that I should start from before I would ask each of us members to thank the board. I just want the board members to stand up. Let every board member stand up in all humility. Forgive me for asking you to stand up. But why are we thanking this board? And you can take seats. They are not paid, they're on pro bono. They are not paid a single shilling. Imagine, you're not paying anyone for making you 150 million. They are not paid. They are doing this service pro bono. So I think that that is where our gratitude must start. These members of the board who have been able to help us reach where we are in 15 months. Number two, we must look at where we need to go. One of the things that we really need to look at, and I think as my brother said, is the pension fund, the retirement fund. A lot of the time we spend time in legal practice. Sometimes as you grow older, you earn more, but sometimes as you grow older, you earn less. Because sometimes you cannot be as agile as you used to be when you are younger. So sometimes you earn more because of experience and people want to come to you because of experience and perhaps you charge more. But in most cases, you earn less as you grow older. I think it is important for the fund, and this is the challenge to the fund, to think about the pension retirement fund. So that as we go along, when you reach 60, when you reach 70, there's something which is coming from the fund. And yes, we can. Yes, we can, because if we can earn 150 million in just 15 months, if all our members contribute, if all our membership contributes, if all the money is sent, we can earn a lot more. You can imagine, as we are sleeping, the Uganda Law Society Healthcare and Benevolent Fund is earning 150 million a year. Number 3, I think it is important for us to reflect on the education scheme. I will tell you, members, as President Emeritus, sometimes I reached the funeral services, and what really caught your mind were the children that were left behind. And when you think about it, and you look at the numbers that the LSK is spending, we can actually do it. But we need to be patient with our fund, because we have so many needs, and yet we are just starting. We must understand that to get to where we want, we must invest and let the return then help us to be able to do what we want to achieve. As I conclude and wind up, allow me thank the Honorable Attorney General who is represented here. Please take back our gratitude. But I want to thank Dr. Suze. I know he's eating, so I'll not disturb him. He was there when we promulgated the fund. He has come back, so I want in a special way to thank him. Let me also thank the treasurer of the Uganda Law Society. Thank you for coming. Thank you for being here. This is your fund. And I think, as the chairperson said, this is your fund. This is our fund. Together we can do a lot. Number 3, I want to thank the past council, which is represented by your worship. Mr. Vice President, please, Emeritus, please stand up for recognition. It's important. And then I'll share a light joke as I sit down. During our council, when the time came for us to do benchmarking, so the question was, who goes? I said, if members see me on that team that is going, they'll say I'm eating their what? Their money. Because I have now gone for what? For benchmarking. So I asked someone else who was more passionate about the fund and who is the vice president to lead the delegation to go to Kenya. So I've never had anyone say that I ate money on the benchmarking. That is on a light note. So thank you so much, and thank you for the opportunity.
Thank you so much, Senior Counsel Bernard. I think you can see how passionate and visionary he is about the fund. Thank you so much for carrying us through, for immunizing us. We are now about to start working, and we are still growing, and we shall still be consulting with you. At this juncture, ladies and gentlemen, we have some members online who have some questions, some very brief questions. We'll take 3. I don't know if there are other questions coming from the online platform, but there is one where the member is thanking everyone for the AGM. He suggests that we should include medical assistance to spouses and children because it's a vital aspect that will ensure the well-being of our members, as it will provide a safety net for members' family needs in times of crisis. And by extending this coverage, it will demonstrate the ULS's commitment to the long-term welfare of the members, and it will foster a sense of security and loyalty. There was a comment from Miss Gloria Oloya. She was questioning if we will have an opportunity to ask the keynote speaker a question. I don't know if Miss Gloria Oloya is on, and we just get her question succinctly. Our IT team. Okay, thank you so much. So members, do we have any questions amongst us here as we take our breakfast? Okay, thank you so much. If we do not have any questions at this juncture, we would like to kindly request that we have a photo shot before we close this session and roll into our AGM. So thank you so much, ladies and gentlemen. Would like to thank our panelists. Thank you so much, panelists. You may resume your seats. Yeah, thank you so much. Sorry. And now, ladies and gentlemen, would like to, in a very special way, thank our keynote speaker, Mr. Menezes. Byron, thank you so much for sharing with us your insights and for holding our hand. Ladies and gentlemen, there is one question though for our speaker. And the question is, good morning. Yes, the ABA is part of the fund, is part and parcel of the fund. Thank you so much. Let's recapture this question and then we ask it. But thank you so much to our speakers, and thank you so much to our panelists. At this juncture, we'd like to welcome one of our partners. We have some of our partners who provide financial services. We also have DFCU, Britam, we have Eden, we have Rhodium. Thank you so much for coming. And now we'd like to invite a partner from Eden to give us something brief as we stretch, pick a cup of tea, and then we come over and I think we should take a group photo now. It's time for our group photo. We take a group photo, then we get some tea, and we come and resume with the AGM. So ladies and gentlemen, let us stretch. And to our online guests, please don't sit. It's important to also stretch so that you're well and healthy. Thank you, members. Could we have a music interlude, please? Thank you.
Dear members, please join us all in the picture. Everyone in the audience, please come and join us in the picture. Even those that have just gotten their breakfast, you can just put your breakfast on the table. Join us in the picture for just 2 minutes and we carry on. Thank you.
Dear members, you're most welcome. Partners, you're most welcome too. Our online participants, please don't leave. We're just taking a group photo, then we get back. Senior Counsel Bernard Owundo is on the line. Please. Please. What? Oh, Senior Counsel Bernard. In the meantime, ladies and gentlemen, you can get to know your neighbor. Well, you don't have to be so uptight. Huh? Thank you so much. Senior Counsel is here. Please. Counsel Asiata will be honored with your presence. Thank you for coming physically and joining us for the photo. Just a moment. Also, you're not in court and you're not submitting, you're not cross-examining. Smile. Thank you so much, ladies and gentlemen. Please let us grab something to eat and then we come and sit and continue with the AGM. Ladies and gentlemen, let's grab our tea briefly. And in the meantime, I would like to invite a person from Eden Gym, someone from Eden Gym, please come and give us a 1-minute stretch exercise before we resume with the AGM. Thank you so much. Eden, you're most welcome. Thank you so much. Ladies and gentlemen, we now have Brenda and James to take us through fitness info. Thank you. You're welcome.
My name is James, and this is my colleague from Kampala. Yes, Brenda. Now, I was supposed to go through a stretch routine. However, the way some of our members here have sausages and cakes piled on their plates, I want to talk about certain things that might help you in your professional career as well as your health. The first thing I want to talk about is it's not what you do, it is how you do it. It is not what you eat to make you think you're living a healthy lifestyle. It is how you eat your food. It is not what form of exercise you do. It is how you exercise. I still eat pizza. I still eat my fried chicken, but I eat it earlier on in the day, for example. It is how you time your meals. Your heaviest meals should always be at the beginning of your day. The same way you go up country, or you're planning to go up country for Christmas, or you're planning to catch a flight to, go to Disneyland with the family, you always fuel up at the beginning of your journey. So what you all are doing is actually the right thing to do. Yes, but try and not starve yourself in the morning. Try and not skip lunch because you have meetings to go for. And then you go back home and you're eating chicken worth the last 2 days. Because all that food is just going to sit in your stomach, and then it will start converting to what they call glycogen. Glycogen is the energy that our body uses. Our body does not use fats. Our body does not use carbohydrates. Oh, I have to stop eating carbohydrates. Every single form of energy is converted into glycogen. If that glycogen is not used, it will then turn into fats. Okay? So my advice is park your car further away from your car park, take the stairs, be more active, use the energy that you have stored into your body. If all of us were bank accounts, hear me out, don't worry. If all of us were bank accounts, all of us would be billionaires because we all have a lot of energy saved for future use. But we don't use it. We don't stretch. You cannot come for a conference for 7 hours, eat good food, and then go back home and sleep. Go for a walk. After this, go for a swim in the evening. It is hot. Take the kids out. It was my son's birthday 2 weeks ago. I wish I could have taken him swimming. Yeah? The more active you are, the more you will stay younger. Okay? Go out for a spa treatment with your wife or your girlfriend, depending on how you live life. Okay? Treat yourself and make sure you look after yourself. Do not just eat good food, wear good clothes, and drive good cars. You have to also treat your body the same way it is a business, the same way it is an investment. Okay? One last thing I would like to encourage you all to do is amongst yourselves, find groups whereby you guys can go hiking. A group of men can have a 5-a-side football team, have a corporate league, play golf. I want to make sure I can see all of you in the next conference in 5 years' time. Okay? Without any complications, without any bags hidden in your coats and your jackets. I know half of us are still concentrating on how sweet the sausage would taste, but you are more than welcome to come through to Eden. Come for a session with me, actually. I love doing legs as well. I've picked you, okay? And I'll be more than happy to answer any questions that might be personal. Sometimes people might have complications that they do not want to talk about here. A bit about myself. I am a physiologist by profession. I spent the last 17 years in the UK and Eastern Europe. I deal with diabetics, people who have hypertension. Normally people come to me if they have to go for surgery, like gastric bypasses or plastic surgery as well. I also work with stroke patients. And of course, I make people do their work on the treadmills as well. So please, 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 people, I want to finish with what I started. It is never what you do, it is how you do it. All right, people? Enjoy your day. Happy holidays, and nice to meet you all.
Thank you so much, James. If there's some questions, ladies and gentlemen, online and here physically, please, you can raise your hand and we answer. James is here. Maybe James, where do we find you?
Village Mall Bugolobi. I'm found at Village Mall. We are found at Village Mall Bugolobi on the 2nd floor, next to the clinic and the spa. Oh, yes, and we shall be seated at the back there if you do have questions. As I know, you never disturb somebody while they're eating food. But feel more that you are more than happy to come and visit us. And I already owe your session, as I said. Yeah? You're welcome.
Thank you so much, James. Yes, we'll be coming. And so now, ladies and gentlemen, we are transitioning to the AGM. I would like to invite our General Secretary, Mr. Philip Munabi, to take us through this session. Once again, thank you so much for coming and for supporting the HBF, the Healthcare and Benevolent Fund. Thank you for supporting. Thank you for remitting your money. And we also thank the ULS for remitting the monies that are required for the fund. And we hope that we can remit all so that we can finalize the process and ensure that we have solid investments. Mr. Munabi? Yes. Ladies and gentlemen, to allow us a smooth transition, let us invite someone from Britam to come and give us insights on financial services, and then we zoom straight into the AGM. Thank you. Britam, you're most welcome. Ladies and gentlemen, this is Mr. Collins Mark Namanya from Britam, and he's going to tell us more about Britam and to encourage you to save and invest and many other good financial issues.
Thank you, Chair. Good morning, everyone. Once again, a pleasure to be here. My name is Collins Mark Namanya, representing Britam, and I'm the Business Development Executive in that area. I'm here today. I know most of you know Britam for insurance, but Britam has gone beyond insurance. Our vision to be the leading diversified financial service provider across Africa. And that has led us to expand our business beyond insurance and try to provide you with more financial services. That is asset management and fund management, a company that I'm representing here, part of the Britam family. That is Britam Asset Managers. And greetings from Britam. This year we're celebrating 60 years in the business. And it's a proud achievement that we've been able to achieve due to support from our clients like you, the Uganda Law Society. And we are glad to partner and say that we are the first fund manager you've considered for the funds under the asset managers for the Healthcare Benevolent Fund. And for that, we thank you very much. So we were talking about investing or saving for the future, for your retirement. But even in the current or present situation, you need to save. Savings are a good way to grow as an individual, as an entity, as a family. And for that, we are here to tell you that other than you saving for retirement or for the benevolent funds, we have other options available. I'm sure a lot of you have heard of unit trusts or unit trust savings. That's one product where you can save as an individual, as a group, as a club, and also as a company. So you're allowed to come and start saving on an annual basis with rates going as high as 12%. And you get to earn daily interest on those savings. So we have a product called Umbrella Fund that caters for all individuals. We also have what we call a fixed income fund for those looking to save for long term. Umbrella caters for our short-term investors. So it allows you to put aside some money That money is going to start making what we call passive income. You get to earn daily interest on those funds. And what I can say is, for more information, please feel free to reach out to me. I've been in good touch with Sandra, but for those who would want to reach out individually, my number is 0789 288 069. I'll just repeat it for our online friends: 0789 288 069. You can give me a call, you can give me WhatsApp. For my email or our email, you can send me a direct email on cnamanya@britam.com. That is cnamanya@britam.com. As financial service providers, we are also available to give you advice in any other investments that you wish to make beyond unit trusts. In case it comes to maybe even real estate, we are also in that market. So Britam is here to give you financial advice every step of the way, and we give it free of charge at no cost. That's one other value addition that comes with you being a client of Britam Asset Managers. So other than that, also, we are able to partner with you when it comes to corporate social responsibility activities. You can always reach out to us, give us your activities that you have now that we're coming to the end of the year. I know the trustees are going to share that with us. So you'll be seeing Britam a lot in your face, coming to partner with you in all those activities. And we are promised to be with you every step of the way. Thank you.
Thank you so much, Collins, for the insightful information. Ladies and gentlemen, at any one time in life, we can all be vulnerable. Today, it could be me, and tomorrow, it could be you. And Mahatma Gandhi once said, the true measure of society, the true measure of any society can be found in how it treats its most vulnerable members. And because any of us at any point in time and life can be vulnerable, I would like to invite Ms. Lindsay Kinkuhaire to give us some tips on how to deal with our vulnerability as we conclude and move into the next session. Thank you.
I have only 3 minutes to say something about being vulnerable and how to combat the stress. First of all, I would say the first thing is to recognize that in the legal profession, you have unique, very unique challenges as regards mental health. Why? First of all, you deal with people's very, very difficult cases. And through those ones, you can't help but also get involved, emotionally involved in what other people are going through. That's one side. On the other side, you need to defend people, you need to prosecute people and things like that. So that's a very contentious environment that you live in. So what does that mean? It means that it's very hard to separate yourself as this man or woman who walks into this profession, because you're not just a lawyer, you're also a father, you're also a husband, you're also a wife, you're also a daughter. There are so many other aspects to your life that are even more important than this profession. So it's important to recognize that the human side of us comes first. At whatever point, the human side comes first. So it's to kind of undress, to put it very basically, is to undress our profession and dress up in who we are as human beings. That's the very first thing I would say. So secondly, emotions, feelings, thoughts, all these are normal things that we all go through. And things like anger and frustration, anxiety, depression are all normal, very normal emotions. God created us with these things for a particular reason. Why? We need to cope with life. So if you, how would you know that this situation is causing me aggravation and frustrations unless you experience it. So we have to experience these things. So for example, anger is a very useful emotion. And you are rightfully angry when you deal with the things that you deal with in the law profession, when something wrong has been done. You get angry, it's normal. But there's a time where that anger can be so much more intensified, and it now comes out of control. So what do you do with that? Is first of all to recognize why you're angry. Why you're angry, and then step back and say, okay, so what can I do about it? Because there's no, someone once said that if you have a problem, first of all, do you acknowledge that you have one? And then if your answer is yes, then you do something about it. Don't fret, don't be frustrated, do something about it. And if your answer is no, you can't do something about it, then that's fine, because you can't do something about it, so let go. So either way, it's important to step back and be able to say, I cannot deal with this, or I can deal with this. Now, the other thing I thought I would say, in your profession, as well as other professions, of course, there's a lot of stigma that goes on among us. You have to have this presentation of a very serious person as you go into your work. So you can't afford to be vulnerable. You can't afford to say, I have a problem. You can't afford to say, I left someone very sick at home, and so I can't deal with this legal issue. You have to stand up and be able to say, I have to deal with these things. So, and the reason is that, how will I be perceived if I say that I actually have a problem and I can't cope with this job or with this task right now? So what is it that we need to do then is to just say, yeah, I have to deal with this, whatever it is I have to deal with, and whatever other people may perceive you, the best person or the best person to take care of is you. Therefore, you wear that life jacket and save yourselves before you can save other people. The other thing about your profession that I thought I should mention is that you really, I don't know if it is a sweeping statement, but there's very little life outside your profession. And because of the things that you do and the people that you deal with, some of you may not even have that liberty to actually go out and interact with people outside your profession. I understand that some of you, like judges and people at that level of profession, you'd actually be very isolated. So that's one of the things that you may deal with. So what are you going to do about something like that, where you say, I can't go and visit these people, I can't be seen in this place, anytime? There's always an alternative. There is always an alternative. And these alternatives are just not like a prescription. These are very creatively generated by you, because it's your lifestyle. There's something that is likely to give you some relief, and you go ahead and do it. But all this has to be intentional. I was going to ask, if you're not eating, my last exercise was going to be that, please write down, if you had all the time in the world right now, you are given an opportunity to do something, what are those things that you have not been able to do that you would like to do? If you can't write these things down right now, someone is smiling, is laughing, there must be something about what you want to do that you haven't been able to do, that you'll be like, how can I even do this? Would you please make note of this thing? This is a serious exercise, by the way, because we always procrastinate. We always put things away and say, well, I'll deal with this another time. And the moment is lost. So please, you have notebooks, write down at least 5 things that you'd like to do if you had the time and the opportunity to do that. Once you've done that, prioritize. What's the very first one you could do? And then the next task is, how am I going to do it? But the most important one of those is, when do I start? And if it's today, that's the best time. So put that plan into action today. I read something today that said, some of you may recognize it or not, but it says that above all else, guard your heart. For everything that you do flows from it. Guard your heart. And your heart, in this case, it's your mind. It is your mind, because out of your mind comes everything. Everything that you do, you have to think about it before. Someone said, thoughts become things, right? So, guard your heart. And that's what you need to protect first and foremost, because it's what drives everything that you do in your life. Thank you.
Thank you so much, Ms. Lindsay. We really appreciate your insights and your guidance. And I hope that every one of us will really do this. So at this juncture, we have come to the end of the pre-AGM, and allow me invite our General Secretary, Mr. Philip Munabi, to take us through the next session. We'd like to invite the board members to come and take their seats at the front. Thank you.
Recording in progress.
Thank you. Good afternoon, members. I wish to call the meeting to order. And as per the agenda that was circulated, I have been informed by the IT and the registration desk that we have quorum. And that's the first item on the agenda. So I think we shall move to the second item, which requires your consent or approval, which is the waiver of notice. You realize that we sent out the notice a few days, I think like 5 days short of the required 21-day notice. So I will request a member that to move a motion to allow us waive the notice period so that we can move to the next agenda. Any member in the room? IT, please display the agenda. The notice, yeah. But it is in the reports that you have on the first page. Any member who is following the agenda can move a motion for us to waive the notice period. As I have explained the circumstances under which we issued the notice, short of about 4 to 5 days. IT, we need a second mic in the room. There's a hand.
Thank you so much. Good afternoon, members. Nasuga Christine Matovu hereby move the motion of waiver of notice of the notice period.
Thank you, Councillor Christine. Anyone to second the motion? There's a hand. There are 2 hands. Who is helping us move the mic?
Thank you, Secretary. Good afternoon, everyone. My name is Michelle Omondi Nyambok, a fully paid up member of the Uganda Law Society. I hereby support the motion to waive the notice period.
Thank you. Our next item on the agenda is adoption of the agenda. Any member to move a motion? The agenda we have is a receipt and consideration of consideration and adoption of the annual report 2024-2025. We'll have a Q&A after that. We have presentation of management accounts, We'll have a Q&A after that. Then we have appointment of an external auditor, after which we shall have closing remarks and anthems. And there is a hand to
Thank you very much, Secretary. My name is Pande. I think on this agenda, I pray that it is adopted with modification of any other business, because there are issues which may come up or which we have in our minds for the benefit of the fund, which if that item is not created on the agenda, we may not have an opportunity to present them. Thank you very much.
Thank you. We were guided that we cannot have any other business, more so on the inaugural AGM. But as per our guidelines, our next AGM is in our next AGM will be soon, but if you have any comments, you're going to present them and we shall adopt them. Thank you. Any member to second the motion to adopt the agenda? There's a hand.
Ronald Chigunda, my name's.
Names, please.
Ronald Chigundo. I second the motion to adopt the agenda. Maybe close to what he has said and what you replied regards his comments. Is at what point, maybe you could guide at what point should those matters that members want to bring in, at what point could they arise? Thank you so much. But I second the motion to adopt the agenda.
Thank you. Those comments will come in after the presentation of the annual report, which is the next item. Or if they're related to finances, they will be raised after the presentation of the management accounts. Thank you. At this very juncture, I'll call upon my chairperson. She's a bit unable to stand for quite long, but she has a presentation that I want us to follow through. She will present from where she is seated. You're welcome, Madam Chairperson.
Thank you very much, Mr. Munabi. My apologies for not standing to make this presentation, but you bear with me. Take that my forward was read earlier on, and if you were not around when I was reading it, it is in the book on page 8, so you can be free, feel free to refer to it. But before we start this, I'd like us to hold a moment of silence and maybe stand up and recognize our members who have since left us since our inception, and to note that we remember your contribution to the legal profession and celebrate your achievements posthumously. I'm not going to go through the list, but the members are on page 9. Maybe you have a moment of silence. May your souls rest in eternal peace. Amen. This annual report is a comprehensive account of the activities of Uganda Law Society Healthcare and Benevolent Fund of Uganda Limited at its first ever annual general meeting for the financial year 2024-2025 and the first quarter and 2 months of 2025-2026. We chose to follow the financial year akin to that of government because of the way the funds flow in. When you come in, you start paying for your funds. So we said, let's follow. So that the point when we feel that most people have paid for their annual subscription, then we can have the annual general meeting. So probably the next one will be more towards June, July, as opposed to having it this late. So brief background of the establishment of the fund. We talked about where we started. We had a three-person steering committee established by council in December 2022 and mandated to come up with a roadmap for establishing the ULS fund, HBF fund. We did some desk research and gathered some information, and we've shared you and from what you've heard from the Advocates Bar Association of Kenya. We were able to gather some information which helped us to start the fund. And I think that has been already mentioned. But we also studied other countries, Rwanda, Tanzania, and we got a benchmark on where to start. So after that, we did an online survey to gauge your appetite. Were you interested in the fund or were you not interested in the fund? And you said you were interested in the fund, and that's how come we are here. But we also gathered data of all our colleagues who had passed away by that time, of 10 years back. So we have that data of all our friends who passed away 10 years back. Now, when you add these other years, well, I think we shall have a compendium or something where we put these members so that we can always remember them and recognize them for their contribution to this society. But also to appreciate the magnitude of the benevolent challenge. When the treasurer was speaking earlier, the honorable treasurer was speaking earlier, he told us about the COVID pandemic. In COVID, I think in 1 year alone, we lost 34 members. 34 members in just 1 year. And that was really, really devastating. And as people were losing our colleagues, some of us were not even aware of the magnitude of the problem, except the people who were in charge at that time. And I think when they were forced to raise the minimum, the amount of money we were contributing from 500,000 to 3 million because of the magnitude of the problem. So we undertook a study tour to Kenya to study the Advocates Benevolent Association. And that was in July 2023. We were led by His Worship Vice President then, Martin Asingwire Bariaroha. And we had 3 members, myself, Philip Mnavi, and Dr. Barbara Kitui. And we were supported by Mary Namale, the actuarial scientist, whom we co-opted so that she can provide technical assistance on insurance-related aspects. So the team's report mapped out optimal concepts which, upon approval by the US Council, were used to establish the fund. So we also worked closely with the ULS Welfare Cluster, and they provided invaluable support and input. We held various meetings with the ULS Council for guidance on the roadmap and discussed the institutional and organizational arrangements. And we established this as a company limited by guarantee, whose members include the Uganda Law Society as itself and its individual paid up members. And that is a clarification I always want to make. And so following an extraordinary general meeting held on the 18th of August 2023 at Fairway Hotel, people moved a motion which was supported that this fund be established, and that's why we're here. It also mandated that same council to appoint the inaugural board, and this is the inaugural board you are seeing here, and whose members were introduced earlier. So now we want to go into the main, I want to go to the main presentation of my report by giving you a synopsis of, can you please go to the next slide? Somebody to go to the slide. Okay. We have talked about that this comment on social well-being of legal professionals is prioritized and supported. Our mission is to deliver compassionate and holistic support to members. And then, of course, our organizational philosophy is guided by compassion, integrity, and accountable stewardship in promoting the health and welfare of our members. We also decided to craft some strategic areas. Okay, what is our ethos, the strategic direction that we want to take? We're looking at some institutional strengthening as key, financial sustainability and resource mobilization. Dr. Alan Mutaga has been talking about what we've done and where we are going. National needs. And then, of course, health and welfare support services. We've supported people who are sick, and then also supported people, families when our members pass away. And then, of course, member engagement and awareness creation, and monitoring and evaluation and learning will be those things that we're going to be looking at in our strategic plan, which we're going to present to you in not too distant a future. How are we governed? It's a lean board of 7 members. It was deliberately kept that way to manage resources. Fortunately, as we speak now, we have not earned any allowances as of now. We made a deliberate decision not to earn any allowances until we've earned the allowances. So now we have invested the money, we've earned some interest. Now we can say, now let's go back and see how we can be paying ourselves for the work we are doing within moderation. So that we keep the fund sustainable. So it includes the ULS Vice President, the ULS President actually, who is an ex-official member. And as we speak now, the President is being deputized by the Vice President. But in absence of those two, we have been working very closely with the Council. Arthur Isiko, the Treasurer, as he said earlier, we've been working very, very closely together. And he's been giving us a lot of support, and I think you should give him a clap. We have the 3 members of the Regional Steering Committee, Dr. Barbara Kitui, and she's not here. And then Philip Mnabi, myself, those were the Regional 3. And we co-opted other people whom I mentioned earlier. Alan Retabe, Financial Investment Analyst, the Actuarial Scientist on my right, and then the medical doctor on my far left, who is Dr. Elizabeth Ekochu, Public Health Specialist. We work through 4 committees: Finance and Investment and Audit, Grants, Benefits and Social Services, and then Governance and Administration, and Communication and Outreach. But when we are determining how much money to give members, we sit as a full board to approve whatever matter may come our way. The Secretariat is currently run by a Fund Liaison Officer. You saw her earlier. Sandra, if you are around, stand up for those who did not see you earlier. That lady has done an amazing job. In her other life, she's a meteorologist. But now we crafted her into this thing. I don't know, probably she will become a lawyer sooner or later. And I like at this also juncture to recognize the people that are seated on that table where the CEO of ULS is seated. I would like to recognize you, please. We're missing one person called James, who's the CFO of the ULS. We've been batting our heads and going into their offices and asking sometimes heaven and earth, but they have been very helpful. So the future plan is for a lean office of 3 staff members, and I think we're going to copy the example of the Kenyan example. We did not copy everything that we got from Kenya for good reason, because we're also trying to look at how can we manage resources and how can we manage ourselves. So the office space has been provided by ULS. It's on Plot 5A, Acacia Avenue. And I think we are seated right now on the 2nd floor. Is it the 2nd floor? Yes, on the 2nd floor, you'll find us there. The audit function, we outsourced management accounts, someone to do our management accounts for 2024 to 2025, but also he did something for us, actually to October 2025. And I think he'll be able to present them for us. And we have also sourced an external auditor to be appointed at this AGM and shall present a paper to that effect later on. Key institutional milestones. That table, the slide you have there, represents what we have been able to achieve in this time that we've been around. So first of all, we developed and approved fund investment guidelines and portfolio distribution guidelines. How do you manage the fund? Before that, of course, we had to undertake some training in financial management and investment decision making by our colleague Alan Ritabi, who has another meeting, so he has gone to attend that. But it was very insightful, and he also invited other specialists to come and educate us about how to manage funds, what are bonds, what are treasury bills, what are unit trusts, things which we thought were just easy. We found that when you're dealing with other people's money, you have to first get that education and understand what you're talking about. And then we obtained a website for this one came later. We then went down and did some exercise which enabled us to appoint fund managers. And initially we had gone that route, we had a custodian bank, but through lessons we learned after that and the cost implications, we abandoned that direction. And then we took only one fund manager through whom we've put our unit trusts, and that is Britam Insurance. I don't think that's the company that is doing it. It's Britam Investment, Britam Asset Management Company. It's a separate company from the insurance. So they are the ones who we are working with at the moment. And instead of going the other route of using KCB, again to manage costs, we went direct and we have a CSD account with Bank of Uganda through our bank, which is DFCU. The DFCU team is here. Can you please wave? DFCU team, stand up for recognition. The DFCU team, yeah. Those are people that are supporting us. We have got our account there. Your money is safe. We don't keep it in under our beds. We keep it in a bank. And then, of course, we also chose to register with the Office of Data Protection Office. Why? Because we are expecting to collect your data, your emails, your telephone numbers, but also certain information that may be private to you. So please, when we come to you to register with us, feel comfortable that we are responsible data protectors and we shall not divulge your information carelessly. We have also had we obtained the standard operating procedures guidelines and application forms for accessing support, and you'll find those on our website. And so we have now looked at how to communicate better. I think we're able to put up a website and we shall be able to communicate with you in a much better way than we have had before, than otherwise before. Support to members. We had to reach a decision at some point before we were even properly set up to support some members because there was a big outcry. People were sending us messages, I need help, can you support me? And we are hardly anywhere. We are not yet even got an office yet. So we're operating from offices, sometimes from Mr. Mnabi's office, sometimes from my office, and other offices, Mr. Muretabe's office. So we decided to start small and give out 1.5 million shillings per member for medical inpatient support, mirroring the Kenyan example. So now we are dealing with critical illnesses requiring inpatient admission for intensive or critical care, some of which we have already mentioned earlier. Betty mentioned them. I understand you can't hear me. Can you hear me? Okay, thank you. Sorry, I tend to have a deep voice, so sometimes it's difficult to hear me, but bear with me. So cancer, heart conditions, serious accidents, people have had motor accidents, people have been hit by thieves with bricks, and so on and so forth. So far we have supported 10 members. There are other 2 or 3 members who approached us for support, but for some reason or another, they have not come to pick their support for some reason or the other. But they are on our radar screen. Then we have got the benevolent support, which we inherited from the Uganda Society of Uganda shillings 3 million to deceased members' family. And then this is to give them a decent send-off. And so far, we've supported 15 members based on, that's the 15 out of the 25 members we have supported so far. However, before we established, between 1st 1st January and I think July 2024. There were other members that the Royal Society had supported. And I think we were in talks with the Uganda Society so that we can see whether we can bring them in as people that were supported before we are incorporated. That's a conversation that is still ongoing and we shall conclude it. Then we had some wellness trainings, talks conducted on mental health, dental health, and cancer awareness. We shall continue these talks, but in a much more structured way so that you can be able to access and to participate. We're doing them in the evening, and then you complain that the evening time wasn't good, you're traveling, you're picking children, and you are still working in the office. So we shall find a good time and you will tell us. We shall do a survey and you'll tell us which is the best time in conjunction with the ULS who always holds these kinds of talks. We maybe will do it every Thursday as has been established by the RNB, and we move forward. The financial position as of August 2025, it has moved slightly by now, and we have collected, these are the funds we have collected so far, 994 million. And then what have been the sources of funds? Your contributions, 100,000, deducted from your annual subscription, and then of course your 75,000 which you top up. It is split between top up of 75,000 you add, and then the 25 which comes from the 500,000. But there was an endowment fund that the Law Society had said they will set up and give us per annum. We have not followed that up because of the need to complete the building, but the funds which we used to go to Kenya came from that source, I believe. And there have been a couple of other small things that the Uganda Society has supported us with. We have always talks, on how to handle certain matters, and the society has been supporting us. But also we cannot forget that we are rent-free, and I think that one should really be clapped for. We are rent-free. I think that if we were paying rent, this would have been an extra cost. The funds have been invested as of 28th August 2025. And I think 629 million has been put in treasury bonds long term, and then 225 million in unit trusts short term. And then we keep cash in the bank just on that off chance when we get need to pay out money to members. So the portfolio is split into unit trusts, treasury bonds, and then cash. So our financial strategy emphasizes prudent investment to ensure long-term sustainability and growth. And then we invested the excess funds primarily in a mix of low-risk, moderate return financial instruments. We are mindful of risk, so we are not going into high-risk areas yet, much as some of them have got very high returns. The higher the returns, the higher the what? The higher the risk. So we are moderate, we are risk-averse. And then we are going to explore other funding avenues, including member donations, development partners, and then, of course, we may plan for a minimal one-off membership fee and fundraising events. Why we're talking about a one-off membership fee? We found that there is a missing middle. People who are lawyers, they have not yet registered as members, and yet they are active in the society somehow. They are young people, either volunteers, and then they have a problem. Recently, we lost two members, I think, from the Ministry of Justice, and we couldn't help them because they were not registered. Then there are other people who, because they have been sick for, like, say, 5 years or 3 years, there's somebody who has been sick for 4 years, and then you feel that they don't qualify to be supported, and then you can see the need to support them. So we're going to look at that area. What can we do? If we each contribute a small fee, one-off membership fee, we could easily collect something like 50 million Uganda shillings or more. We can put that in a separate fund, which can then be used to deal with those kind of issues which come where you need to support from a humanitarian perspective. Have we had challenges? Yes. But do we think they are insurmountable? No. So, of course, delayed establishment due to acquiring office space was a hindrance, because we are hoping from one office to the other. Where shall we meet? We go to, running around different offices and having no fixed place of abode. Then, of course, we needed to familiarize ourselves with the investment and insurance field of bonds, units, and trusts. It took us quite some time to learn, and that was a challenge, but we were able to overcome it. We had some technical glitches and delays in registering formative documents. but that one is we are going to sort it out. We needed to start, so we filed the documents. Then they keep coming back to us. Who is this? Why isn't this one signing? Why are you? And we had challenges, and they delayed us a lot along the way, but we shall deal with them and sort them out. Actually, we are on our way to sorting those ones out. Lack of data protection license hindered a direct member communication. But now we are registered, got a license, and I think Sandra will be sharing the license number so that you'll be comfortable that we're not just keeping your data with backup. So what are we going to do about this? We can leverage member numbers to negotiate perks and discounts with service providers. And I think I don't have to labor that because this morning, there's a discussion that our friend from Kenya has helped us to highlight what we can do with the numbers. We've been telling the insurance companies and the people from Britain, this is for you. We've got numbers. We've got numbers. Go back and tell your bosses to think about us and give us packages that make sense. One insurance company was telling us, we're going to give you a package, but we want you to pay 1 million shillings per member. I said, no, that one is, I can't understand that. We're bringing you numbers. I see you smiling. I've got numbers, okay? So look to us and give us good package for our members so that we can have a sensible cover that can help them when they are ill and when they have challenges. Benchmarking and learning from sister lawyers associations is something we are doing in earnest. Kenya Benevolent Association, you've heard about that. The Vice President had a conversation with me earlier. Unfortunately, he's not here. And he said he had talked to the Ghana Law Association, I think, and Nigeria. And I think he's going to link us to those so that we can benchmark with them and share their experiences. So having an office with ULS premises facilitates member access and is a cost-saving mechanism. I cannot say that enough. It's an opportunity, and we've taken it in good faith, and we're enjoying it very much. Thank you very much, Mr. President. ULS clusters and regional fraternities present opportunities for member outreach. We are going to now start. How do we reach our members? Because you heard from the ABA of Kenya that one of the challenges was that they are so centralized in Nairobi. We are going to have to find ways and means of reaching out to our members in the region. We shall piggy bank on the existing structures of the ULS and see how we can reach out there, and where we can form clusters where people can be reached. Already I can see people forming. I've got clusters. There's the Eastern region bar, something going on. There's the Northern bar. So we shall piggy bank on some of those things so that we can reach out to the members. And we intend in future to go on a road show, to go out into these regions and meet these people, so that we don't be seen to be a Kampala-based fund. So what is our future outlook? We want to, the comprehensive contributory life and health cover is at the back of our minds. Whether it will come in the form of a retirement benefit scheme, we don't know yet, but I think Alan this morning threw some light on that issue, because we see a gap. We see a gap. We see a gap in the medical cover. One patient alone who has got cancer needs 100 million shillings and above. 100 million. If we get 5 of those, and we're getting 500 million a year, it will wipe out the entire amount before we even touch the benevolent side. You get what I'm saying? So, a big button. Yeah, there's a time we had 4 people. And I mean, it was just incredible. And we were saying, okay, whom do we support? If we get 100 million and give 1 point. In fact, somebody was telling me, you give them the money. I said, if we get 4 of them, then there will be only medical and there will be nothing to pay for the benevolent side. So this is a subject matter which is very important. And when we call upon you to come and enrich that debate, please come in and give us your ideas. We shall be open to listen to you. Communication and outreach. We've been a little bit slow in this communication and outreach, and you've been complaining, but we are coming around. We have now a website. We have got our handles, Twitter, and I think we are on YouTube. And what else? I'm technophobic. LinkedIn. So we are going to be there, and please look out for those, and also our website, and go to the frequent asked questions. Post your questions there, and we shall listen and answer them. Subsidized rates for wellness services. Dr. Betty has talked about that. We are going there. we shall soon come to you. We have talked to most of the service providers, and some of them are seated at the back of the table. There, so when you're going out, please reach out and pick their flyers. The question of onboarding family members is very, very high on the agenda of most people's lips. But when you have not finished understanding the 5,000 plus members, your family, the inner family, then you now bring in other people. You have to be very careful. We're not saying it's not something that's legitimate that we need to look at, but we are walking slowly a little bit, understanding what needs to be done and how it should be done. Perhaps the retirement benefits scheme and other schemes we are looking at may be the way to go. We shall go to engage the insurance companies, as I said, take our basket of members and tell them, gentlemen and ladies, we've got a mass movement of members. Please give us a good product which our members can afford. Because not every member is going to fall sick on the same day, and God forbid, we're not all going to die on the same day. So our insurance companies, Britam, this is for you. This is for you. Come back to us and let us talk on this issue. It's very, very important. Retirement benefit scheme proposal, we are going to take it up and we shall come back to you and we have a conversation on that. Fundraising activities, we hope to raise fundraising activities. As I said, there are some members, the missing middle, who haven't paid, who are not able to pay. Some of them are retired. And we also want to start visiting sessions to go and visit our elderly members. How many of you have visited an elderly law society member, your colleague, your former boss, in the last 1 year or so? I was told that one member was visited since he retired from a big office. When members went to visit him, he broke down and cried. So we need to reach out for our fellow members, even amongst your cohorts. If today, in the last 1 month, you have not talked to any of your cohort members who are not in your circle of friends, lift a phone and call that person if she's on your group. If you have not heard from her or him, call them. Say, Lydia, how are you? How have you been? I have not heard from you. Please, let us reach out. Because what we tend to see, when people fall sick, we all rise up and with Benevolent Fund, what are you doing? Where is our money? But when that person, there's someone who was sick for 4 years in a hospital in Mulago, and we didn't know. We went there to see another patient and we didn't visit him. But then the question is, where were his friends? Why didn't they tell us? Let us look out for each other. So, of course, we are going to review the current support mechanisms. We are going to piggyback from our Kenyan counterparts, well knowing that the Kenyan economy is much stronger than our economy, but we'll still try to match. And if you can see, some of the visions we're making are matching quite well with the Kenyan economy. So with the Kenyan Advocates Benevolent Association. In conclusion, we have come from afar and are grateful to you and to God. I'm a strong believer in God, that without him, I don't think these things would have been able to pass. The first year has reaffirmed the essential purpose of the fund to create a safety net for well-being, dignity, and resilience of our members. It has laid the structural governance and operational foundations for sustainability. It has enabled us to lay the structural governance and operational foundation for sustainability. It has demonstrated that the strength we have in numbers. President Bernard Owundo raised that issue. When we come together to invest in our welfare, we can do what? We can make it. Yeah? We can do it. Can't we? We can do it. The trick is in the numbers. If you bring 1,000 shillings, all of you members, if we are 5,000, you bring 1,000 shillings. Those who are mathematicians, you know how much that will be. Just 1,000. One time we were looking for some money and I said, if everybody bought 1,000, we'll raise 20 million here. 10 million. And we can support that person and that issue goes away. The challenges offer lessons to strengthen our resolve and sharpen priorities for the future. We remain committed to expand and deepen our services and grow the fund into a trusted pillar of security for every lawyer. For every lawyer, we would like to see that we reach out to every lawyer as much as possible. And then we intend to engage more robustly with enhanced transparency, ensure lightened prudence in resource management, integrity, and compassion. Thank you for your support. And I think that much as I am a bit lame, I will stand up. Because I don't want to thank you when I'm seated. Thank you for your support and for your belief in this vision and for entrusting us with the plan. Anybody who entrusts you with their money, you know that they have you at the bottom of their heart. We don't take it for granted. I thank you very much.
Thank you, Chairperson, for those wonderful remarks and report. As you have heard, we have not eaten your money, but we are giving out your money. It's quite challenging when you hear the numbers. Actually, in the initial stages, anyone would think if they give you money, just give it out. But we went through about 3 months of training. A unit trust, when you talk about it, you think just put money there, but we did the background study, and it took us too much time to understand these things. We had over 6 presenters on finance alone. So that's how far we have come. Any members with any reactions, questions, and comments? Comments, IT team, if there are comments online, please forward them. If we have someone was helping us move the mic, our office is still small. We have one staff who manages 7,000 members. For the last 15 months. If there is any question or comment that you would wish to raise, please put up your hand so that we can discuss it and see whether we adopt it in the, there's a hand to, yes.
Thank you so much. I want to appreciate the chairperson for that report and the whole entire committee for that dedicated time and service and all that. It's not easy. And you know, dealing with lawyers is one of the difficult tasks. But good enough, we have non-lawyers on that committee. I think it will help us survive. So thank you. We really appreciate. My concern is on the send-off amounts of the 3 millions given to. Once again, my name is Ronald Chigundu. I practice with Onyx Advocates. On the 3 million send-off given to a member or a member's family, this is my thinking or my proposal. We can deliberate on it. Of course, that is, like you can hear, it's just trying to help. It's a benevolent gesture, but it can't be enough. It can't be enough, and they can never be enough, probably. But I was thinking, like we have other partners here, why don't we think or look at partnering with a funeral home? There are many now, away from the ones we used to know. We can partner with a funeral home, and they can give us a subsidized, since we are giving them business, sorry, but it's business. That is the fact. It is business to them. We could partner with any of them and narrow down to a deserving send-off for an advocate. We could figure out a particular figure and then narrow it down. And then maybe we could add on, or so that this amount of the 3 million either fits within that amount, and then you could maybe say 1 million will cater for
a casket and everything, that part that is done at that time, and then maybe the 2 is given in cash. Or we could increase along the way and we say we are giving one, maybe you could negotiate with that company or funeral home and they maybe meet at a cost of 1 million or a chair figure, which is really affordable. And then the 3 is also given in cash to cater for other bills. That is my proposal. Thank you.
Thank you. We can balance the equation. Madam CEO had a question.
Thank you, Chair, for that beautiful presentation. For me, I'll just seek for clarity. Each member pays 75 every year, and ULS adds 25 on top of it to make it 100. But I also heard that ULS had promised to make a contribution to the fund. So maybe if you help us understand, does this 25 make a contribution ULS promised to give, or there's another expectation of another contribution? That's number one. And number 2, the keynote speaker spoke about lifetime membership or insurance. Now, can we introduce it to all of us to make a payment to help people who die when, let's say if they last paid like 4 years ago, and in hospital, no one knew they were sick, then they pass, and then when it comes to Benevolent, we say no, they're not paid up, we cannot support. So if you can introduce that, so there's a lump sum someone pays, and even when I don't pay that year, I can be catered for. Thank you.
We'll take the 3rd question, then we answer. The gentleman in a purple shirt. Oh, thank you.
Mine may not be in line with the questions for the moment, but I was just thinking through some of the missing gaps that you had said. Of course, the fund was intended to benefit the advocates, but there are those advocates who practice without PCs, and your long-term plan is to think about how you can bring them on board. So my question is this: with the current name that we have for the fund, would we be inviting people with a potential conflict of interest? Because that is the main reason why they don't have PCs, like the advocates in government service. But when you look at the name being associated with the Uganda Law Society, and you bring a judicial officer on board, in the long term, I think we should think about our name as we think about the long aspect, because the name carries the brand. The name comes with a conflict or a potential conflict of interest, and then it also comes with misconception. So I'm just thinking, could we target the profession without including the society aspect? Is there something we can do to the name? I don't know if I'm understood. I'm seeing someone not getting it. All right, thank you.
Thank you very much. Mine may not be questions, concerns, comments, but there are issues to address. One, it is very dangerous to start ensuring that your neighbor's children is satisfied.
Your name, please.
Pande Norman. It is very dangerous to ensure that your neighbor's child is satisfied when yours are hungry. So let us ensure that we, in the interim, because there is a lot of future in this, let us restrict ourselves to the resolutions of the meeting of 18th August 2023. There is a lot of ambition, there are a lot of products, but let us first look at why. What was the problem at hand at that time? Otherwise, we may talk a lot of things and we forget the gist. Secondly, one thing I noted from the key speaker, which is key for this report. He said that their association is an arm of Uganda Law Society. He said the Association of Kenya is an arm of the Uganda Law Society. Therefore, my request is that whereas we have to do things independently, we need to seek for political will from the ULS Council, because you know the decisions that we make here will carry more weight if they are sanctioned by the membership at the annual general meeting of Uganda Law Society. I want to look at the proposal number 6 at page 20, where you are proposing a one-off membership fee of 55 to 10K. That would not be a big figure, but we need to consider that the majority of the members you intend to look after are without fear of contradiction, younger lawyers. Actually, some of them up to date are struggling to renew and pay up subscription for this year. So when we bring in proposals of telling them to make payment, when they already know that they are paying money, which money, part of it goes to the benevolent. So my request is that that proposal is good, but we can look at it in the near future. Now that the secretary is here, I mean the treasurer of Uganda Law Society, I have looked at page 20, the financial position, and said this year you have received 472 million Uganda shillings. As a member, I do not want to task the board because for you receive, but I would want to hear from the treasurer. Is this all we have for this year? Because when you look at the latest CLE compliance report, it has 7,713 members, and it is provisional. So I would want to know, is this what we have? Then, Madam Chairperson, in your presentation, you talked about adopting the government style of financial year to hold the general meeting, this meeting. That will cause us a problem because we shall not be in position to monitor how much money the ULS mainstream has remitted to the Benevolent Fund for that year. So at least this time of the year, in December, you at least know that at this time, very few lawyers are actually willing to go and pay up because the year has 20 days. So I propose that we leave the AGM the way you have scheduled it this time for us to be in position to follow our money properly. Because at this time now I can ask how many members have paid this year and I can get an answer. But in June, it will cause some follow-up problems. Then you've talked about non-members, people who have paid and stopped paying. I want to appeal to you that those other good proposals, let them come later. But for now, if the meeting of 18th that initiated this looked at paid up members, it is a matter of encouraging members to pay up. It is a matter of encouraging the stakeholders, the politicians, because I saw Eastern Bar, people were there running around. Now, this is a product of ULS Council. I have not received any explanation as a member why none of the politicians is here. Don't look at Isiko, he's a treasurer, that's a technical position. You get it? You know the power they have in promoting brands, that is not disputed, that if they embraced this product and they saturated it, we have not more than 100 people here. But if the technical wing of ULS woke up and called for a meeting tomorrow in the same venue, you'll see people flooded. So there is a link that we need to create and know whether we have a supporting ULS Council or they are ceremonial supporting ULS Council. The report talks about their support, but it is not tangible here. As a member, I am interested in seeing them mobilize for the Benevolent Fund. You get it? Otherwise, me, I wish you well. I have no intentions of sabotaging your activity, but I wish that the board thinks of putting a person who has voting rights, who represents the entire majority. Because most of you are technical people, but you need some other person. For example, if I proposed at the AGM that we vote a representative to the board, like we are voting somebody to represent us to law council, wherever we are going. We have the vice, we have the president, but you have already termed them as ex-official members. We need somebody with voting rights. That is mine for today. Everything is made in good faith. Whoever is hurt, please leave it here.
Thank you very much. Okay, let's get one more. Let's get one more and then we can answer them. Thank you very much, Mr. Andy.
A very good afternoon, everyone. Geoffrey Tuliam Sima is my name. I have to first take note of appreciation to the board. Thank you so much for the work well done. What you are doing and the instance of this fund will not only help me, but also my children. It is great work done. I have a few questions and I do not know who in particular will answer them, either the board or the treasurer we have here. The first question is this fund compulsory to all advocates? Is this fund compulsory to all advocates? And if the answer is yes, why is the amount of money don't tally on page number 20? Why is the amount of money don't tally with the number of advocates our CLE list? Thirdly, where is the problem? Is it the fund that is intentionally refusing, or the board which is intentionally refusing to go and pick money from ULS, or it is the treasurer who is refusing to transfer the money? Fourthly, is there a balance, and if yes, when can it be remitted to the fund? Then lastly, there is an issue of sensitization. We are more than 5,000 advocates, but very few understand this. And if you follow up online, we may again not have thousands of us online, not being different from what is in this room. I would suggest on our annual budget, we include some money so that we can do the sensitization, the education, or we make everyone know or get to know about our fund. Thank you so much.
Thank you. We didn't capture the name of the lady who spoke before Mr. Pande Norman. We never captured your name.
My name is Gilfin Mokeira Omwenga Burudi.
We have questions online, but we will take them later. Let's first get responses to the questions that have been raised.
Change the microphone. Give us that one. Okay, is this better? Okay, I'll start with the question that has just been raised by Mr. Geoffrey Turiam Sima. Copy the name. Just copy it somewhere. Some of the questions you've raised, I think, will be answered by the treasurer, but all the monies that they collect from the membership subscriptions and the top up of 75,000 is passed on to us, and what we receive is what we invest. However, we find that because of the way monies are paid in over a period of time, some people have started paying for 2026 as we speak now. Some people would like to pay ahead, so they are paid ahead, but they usually wait for a certain amount of money to collect, and then they send it over to us. But also, we also wait to get a certain amount of money that makes sense to pass it over to the investment areas that we've chosen. So sometimes there may be some delays there. On the issue of sensitization of advocates, thank you very much, Geoffrey. We'll take that up. It's a serious matter. We've been thinking about it, and it has to start like yesterday. We don't tend to pay attention to our health at times. And sometimes because we're busy running around looking for money, health issues, benevolent issues, we don't pay attention to them. Now, this is the time to start paying attention. And whoever has come to this meeting, please, when you go out there, talk to 3 people about the fund and tell them, you know what, the fund exists and is working. Thank you very much for that comment. Now, with respect to the comments made by Mr. Bande, I hope I got your name right. I'll start with the right one, the last one, which you mentioned, that we need a representative who represents everybody. Actually, this board, being an ex-officio member of any board does not mean that you are not a member of that board. Neither does it mean that you're not representing a certain constituency. So actually, the Uganda Law Society and all of you members of the Uganda Law Society are represented on this board by the president himself. The president himself is the one who represents you on this board. Okay. However, due to his heavy docket, we provided that when he's not present for whatever reason, he's busy, he can be deputized by the vice president. So the vice president of the Uganda Society is a member of this board. And therefore, when he's there, what is his role? Is to actually represent the interests of the Uganda Society and its members. And that is why, if you look at this report, you'll see his picture here. He's representing the president of the Uganda Law Society. And that's why he gave out his foreword in that report. I think the foreword is the very first thing that happened in this report. This is not, it was not there by accident. It is for significance of the importance of the Uganda Law Society to the Benevolent Fund. The Uganda Law Society is the mother, the Benevolent Fund is the child. So Uganda Law Society is the parent and we are the child. So it's on page 7. Please go back and read his remarks. He's there to have an oversight function over the fund. And Mr. Isuko will tell you, we've been working together with them. Sometimes the people reach to the vice president or the president himself, and then he sends us messages. You people, there's something here. Please go and look into it. Sometimes we sit together, exchange emails, and find a solution to a problem, and we have worked together very well. The president himself sends sometimes messages. Where are you having problems? Where are you having challenges? How can I help you? So we may not be so overtly showing that there is a relationship, but the relationship is there. And I want to give you comfort that council is aware of what is happening in the Benevolent Fund, to the extent that they have been able to send Mr. Isiko to represent the president of the Uganda Law Society. And I hope that answers that question. Now, when we talk about paid up members, it is always very easy but to be very prescriptive. And yes, what shall I say? The standard is that the fund deals with paid up members. But what has happened? We've seen, since we started, somebody has paid for 2024, and he's very, very sick for 2025. Extremely sick. I mean, when you visit these people, you have to come. I think one of these days when I'm going to visit some of these people, which I'll ask you to come with us. You reach and yes, you see that member, and there is no way under any circumstances that you can ask that person to pay. There's a gentleman who was sick for 4 years and nobody visited him. He even called and said, you know, my friends don't even pick my phones anymore. So what did we do? We sat with the Uganda Law Society Council members and said, what do we do? How do we handle this situation? So the Uganda Law Society waived his requirement to pay the back subscription fees and then got money from the Uganda Law Society and paid for the years that he had not paid to the fund. And we paid. We supported that member. In another incident, another member, a very important member of this society who had done work for this society, who started the legal aid project and was a council member, he died and he had been sick. So the classmates, of which I am one, we collected money and paid his back for 2 years. We paid his fees for 2 years, the 500,000, the 75,000, and we then released the money to him because it was going to be remiss of the Ugandan society to be seen, not to appear at that gentleman's funeral. And then we learned later that actually he was a member of council, he was a secretary of the Law Society at one time. Now, not to appear there would be like, what is going on here? So I mobilized my classmates. I said, we have a problem. And they said, no. First of all, they raised money for his hospital bills and they paid some money there. Then they said, we're going to raise money. Lydia, you go and pay all these what? Dues. And we paid them. And when we paid them, then they said, okay, then I had to talk to my colleagues here to agree to support that gentleman. Not supporting him would have been not a very good thing for the Ugandan society because of his contribution to what we had done. So yes, we hear you, Mr. Pande, but you know, you have to have a human face to this work we are doing. You find yourself to put a human face. And we put aside the regulations, not because we're not aware, and we find ways around it. Sometimes we contribute money from our own pockets. There's a time when I had to contribute some money to a patient in Mbarara who had an accident so that her sister can be able to travel to Mbarara to take care of her. And I knew she wasn't going to be able to pay for 2025. So those are some of the things that we're dealing with. And visiting them. Members who are seated here have gone and visited those people in hospital. They have not come back to ask Sandra, give me my transport allowance. Because I went to Mulago, I went to Rubaga, and one of the people that you really need to put your hands together and thank, there are two people here who have been running around to hospitals. Mr. Philip Munavi. Dr. Betty Ekochu. Dr. Barbara Kitui. Me, I'm usually more on the phone, but these people, they get out of their way. Let's go and see this patient. And Dr. Betty Ekochu, when she gets there, she doesn't stop by just going to see the patient. She goes and moves her colleagues in that particular hospital to take care of our patient. Now, that is something that you cannot count for. So the annual, the treasurer's issue, the treasurer will answer. The annual subscription of 10,000, 5,000, I think somebody mentioned it here. I don't remember who it was. Who talked about that bottle of whiskey or that bottle of beer, that packet of cigarettes, that new shoe? I think the guest speaker. You need to make a choice. 5,000 may appear to be a lot of money. When we put it together, it will help us with those people who at any one given time cannot afford to pay. Today it may be somebody else, but tomorrow it could be me. Yeah? When I fell 6 weeks ago, I just cannot imagine that on that day I would be like this. But there I was. And I had gone for a meeting, by the way, to get somebody to support us in the fund. But that's a story for another day. Political will from council. Political will from council is there. Vice President called me today to excuse his absence that he's got another engagement, and therefore it's not by accident that he's not here. I am sure that I think President Semakade, wherever he is, he's probably online and watching us. He even one time actually came and he had some visitors from the Church of Uganda who were having a meeting at the ULS, and he brought them in the room, and they actually prayed for us. So maybe that prayer is still with us and has given us the legwork we have been able to achieve. So yes, restrict ourselves to the resolution of 18th August 2023. The fund is evolving. When we were starting, we had a mindset of certain things. The practice of running the fund has taught us a lot more than what we thought. Even the ABA, which started in 1947, where they are now, where they were before. For them, they were taking care of children of their deceased members. Now you saw what the gentleman shared. They have moved away from there. So we shall be evolving, and when new things come, we shall have to look at them. We shall not be static. So who else? Yes, this issue of members who don't require a practice certificate to members of the Uganda Society. That has already happened, and I think we already had a conversation with Mr. Souza. Personally, I don't see any conflict because most people who are even in the judiciary are first lawyers before they become. We have got His Worship, Martin Asingwire. So what do we now tell him, that Martin Asingwire, you are conflicted? You cannot be part of this? I don't think so. I think that there will be no conflict. I think we're all first lawyers, and the members who do not require practice certificates, we're going to find a way of handling them. The Kenyan Association has a specific clause which caters for people like that. So we are going to look at our guidelines and see how we can cater for them. We're encouraging them to come if they want to come. And I think Barbara, who comes from the Ministry of Justice, is already engaging to see how we can help those people who are seated there and in other offices to see that they can join the fund. So I do not see any conflict of this being sitting in the Uganda Society, personally. We have had issues, but let us not mix up these, let us separate these issues. I think it is a good thing for this thing to be seated in the Uganda Society. I think there are many gains to be had. Even the Kenyan one is seated in the Law Society of Kenya. There are gains to be made, and I think we must be very clear-minded in what we're trying to do so that we do it. As long as we appreciate the dichotomy, we appreciate the Chinese wall, but we understand there's also permeation between that wall, between us, and that's what has been happening. Anything else that I've forgotten? Oh, yes. The contribution. I think President Bernardo Wundo's council had made a resolution that they will be contributing 50 million shillings per year to the fund. At that time, they did not know whether people will have an appetite for the fund to start. So that was separate. When the fund started, you people got an appetite. They said, no, you can top up 75. But they already made a decision to take 25,000 off and put it on this side. When you look at the 25,000, it's much more than 50 million already. So that was a separate issue. But now, because of the challenges you've been having, you're still constructing the house, maybe this is something that you can consider after you have completed the fund. Because when you have that fund, and Mr. Treasurer, that this is for you, we can invest it separately to deal with these those things which are now coming and hitting us. It is easy to say no, you are not paid up. It is difficult when you're looking in the face of the Lord who has been sick for 4 years and has not been working and say, no, we cannot support you. That's when we go to that fund if we put it up. And it's a one-off. Membership fee, one-off. You pay it, small, 10,000, and then you continue paying your annual subscription. The lifetime membership issue, we shall look into it, Madam CEO. We were just not sure how it will work and how much it will be. But we've got our people here, Maria here, that's her work, to find out how much it will be. And of course, it has got a scientific undertone around it and mathematics around it, which I'm not very good at. So Maria we'll give that to you to find out what would that be if we were to have it at all. Yes, thank you very much. That was Mr. Chigundu for that suggestion. We shall think about it. We've been thinking of partnering with different partners, and that one really is a good one. We shall look into it and go and see how we can partner with people like that. But again, the issue of the 3 million, as President Bernard will tell you, was based on giving our lawyers a decent barrier. So we look into it and say what that comes up to and how we can continue to help the families. And thank you very much. I think I have handled most of the questions. Are there any other questions online?
Thank you, members. We could take 1 or 2 more questions or contributions. There's a hand at the back. Mr. Chigundu, the mic is coming to you. There's a question that was addressed to the treasurer, I think is also...
Thank you so much. Mine is just to, I think, on the issue of the 75 that goes to the fund from the ULS accounts. I don't know whether it is the right time, but I would propose, or I would move a motion moving forward, because I think by then we didn't have an account. UBF didn't, HBF didn't have an account by then. But this is my proposal. I would suggest that moving forward, like we pay other amounts, East African Society and which other do we pay? Different separate accounts. On paying, when the year begins, on paying the other amounts, let us have a receipt where we pay the 75 directly. So that amount gets directly on the HBF accounts. And then HBF only follows up on the 25 per head from ULS. That will sort in case of any delays and all that, because now the account is already available. So when we are paying, we pay the 75 directly to the HBF accounts. Thank you.
Thank you. I want clarity, Mr. Chigundu. Are you proposing or moving a motion?
I am moving a motion.
That?
I am moving a motion that moving forward, since now we have the HBF as an account, as a fund, we do not need now to move around. Let the 75 that we passed in that other meeting or that we agreed about, let it move directly to the HBF accounts via that number at DFCU. And that HBF now only demands 25 from each individual from the ULS account. Thank you.
Thank you. There is a hand.
Thank you so much. Mine is different. I think I reject his proposal because of mainly one reason. You know, us advocates, especially practitioners, are interested in PCs. We are only interested in getting our PCs. Most people do not see the incense of this fund now until they get a problem. That means that someone will be comfortable to pay for subscription and intentionally refuse to pay for this fund, which will be a problem tomorrow. Thank you so much.
The gentleman needs to clarify. And there's a hand.
I think there's no confusion to this, because we already know that the 75 is part of you getting a what? A PC. And if you don't pay it and you intentionally refuse to pay it, when you go to the chief registrar with all the other receipts, you won't be able to receive your PC. It is the part, like you pay, like you pay those other fees that we pay, that is East African Society, and which other? I think the ID and all that. You do not get your PC without paying for the East African Law Society fees. So it's already tagged on that one. It's just a matter of changing in that now it is paid on a different account and not the other account. But it is already tagged on. And maybe to inform the relevant authorities that it is the part of that amount.
Thank you, Mr. Chigundu. We had a hand on this side. Ladies now.
Thank you. My name is Sila Isata, and I would like to second the previous speaker. You're very right. The administrative issues can be sorted out. Yes, we want our PCs, but if you tell us to pay certain monies to specific accounts, we will do it. The Uganda Law Society can also require that before I get my ULS receipt for the PC, I present the receipt from the Benevolent Fund, right? Now, again, how are we going to resolve these issues when there are no AGMs? But perhaps since the Vice President is on the board, he can influence that policy, or they can discuss it in council so that it's effected. That way, people will stop having all these questions about, has all the money been remitted? Thank you.
The motion has been seconded by Isata. I don't know if the third member is seconding or also giving the
Thank you.
second.
Thank you so much. I second his proposal, but I realize this challenge that we have. We've not been having AGMs. I believe this board has to report this proposal to the what? To the ULS AGM for this to be conclusively resolved. So if this doesn't have, if we don't have an AGM, then I don't think we are going to have this resolved. So if we have an AGM next year, this can be presented before the ULS AGM, and it can be resolved by the members who pay the 75,000. Thank you.
If we have members online listening in.
Mr. Secretary, Mr. Chigundu has a very good proposal. I also had it in mind, but it is a solution to a problem which we don't know. We are proposing that we take this money directed to Benevolent Fund, but we are also saying that some people are saying money, 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 but we need to first understand from the treasurer before we go into the suggestions, how much has been collected, how much is the Benevolent Fund entitled to, and why has it not been remitted? How much has been remitted? What is the balance? Is there a technical problem? That's until we can find those solutions of if there is a problem of whatever matter, let us now tell members to create, direct it to the accounts. But this issue of also paying money to ULS and is remitted, it is one of the checks and balances where the board can account to the ULS Council, and ULS Council somehow is also answerable to the board. So we don't need to separate these powers, but we need to find a solution. How much has been collected? Why, if any, has not been remitted? Then we shall come up with those solutions. The good thing the treasurer is here. Thank you.
Let's give him a chance to respond, because we haven't given him a chance to respond.
Thank you, everyone, for bringing in the questions, the comments, and the concerns. In fact, when I was discussing with the Senior Counsel Emeritus,
this one better?
yes, I hope now I can be heard clearly. Yes, first of all, I was thanking each and everyone for bringing in comments, suggestions, and the questions. And I was also saying that I had a discussion with the Senior Counsel, President Emeritus, concerning an issue where I think I should also raise it personally, that I think we should think about merging the AGM of the Benevolent Fund and the AGM for the society as a whole, because it can actually reduce on the back and forth. You hear some members saying this is something we should take to the AGM, and this is also an AGM. In fact, the beneficiaries are all the same. The parties are all the same. So, and then also being the treasurer, also the issue of reducing on the cost. I believe now there is a cost that the Benevolent Fund will incur on this day. So think about a situation where we merge the two. We'll probably hit two birds with one stone, and actually also come up with resolutions quickly without referring to another AGM that we don't know when it will happen, given the current legal battles that we have. I hope, Madam Chair Lady, you have noted that concern. Going to the issue of the remittances that we normally make. For those who have been following the periodic reports I've been making, the trend has been that as a society, we make quarterly remittances because people make payments on different dates. As we speak, there are people who are making payments today. So it becomes hard to make transfers on a daily basis. We normally do it within a span of 4 months. In fact, in January, I was making payments. January this year, I was making payments for last year. So the same trend normally happens. In as much as you see that we are referring to 7,000 members and we have remitted less, we normally do it within at least 4 months, so that we collect the sums, the accounts does the balancing periodically, then we make payments. And of recent, we always have discussions with the Madam Chair Lady at how much we need to remit, depending on how much has been paid. And I think very soon we shall be making another transfer. I may not have the figures on my fingertips, since this is not something I had anticipated. In fact, I was also talking to Emeritus. I told him, since majority of the questions are coming to the treasurer, it is high time people consider putting the treasurer then, or whoever will be, as an ex-official to answer such issues that will be arising, because these are issues concerning money in one way or another. The treasurer will find himself answering to some of those issues. That is something probably that can be looked into. Something very important came in, why maybe some council members are not here. For the record, it should be noted that there is a political goodwill by the council towards all activities of the fund. We back the fund in all the activities that we do. In fact, at some point we have meetings where the vice president attends and I also attend, and we discuss so many issues, not limited only to what is currently here, but even to what policies can actually be brought forward and ensure that there is a better service that is given to the members. I'll make it a point that at least I send out, I make a report. I'll be instructing my team at the Secretariat to come up with a comprehensive report so that I can actually share it with the fund, and the fund can actually share it with the members, and as far as compliance is concerned. Thank you.
I think that we've taken note of the suggestion that you've made. Thank you very much, Mr. Treasurer, Honorable Treasurer, for explaining this. All I needed to add was that the way we've been working is that we always communicate with each other, and that we take the responsibility of the ULS. It's kind of like a supervisory function over us, because all our members are members of the ULS first before they cross over to us. Those who pay the 75, you come this way, and then you get the matching 25,000 from the other side. So I just wanted to make that clear. So what I suggest for now, thank you very much. The motion has been picked up, and as my colleague, the lady on the other side pointed out, it has to be cross-referenced also on the other side. So let us give that chance to happen. We are in a state of little bit of state of flux as far as the AGMs on the other side are concerned. So let us give it time. We've taken note, Mr. Chigundu, and all of those who are proposed. In the meantime, as we wait for the AGM on the other side to happen, we shall have a conversation between the two of us, so that by the time it does, we shall have a motion to move on the other side, which shall be corresponded with this motion that we've moved this way, and it will pass. On the issue of holding AGMs together, it was the intention. It has always been the intention, because it saves money, but circumstances have not allowed. However, I would also like to make a suggestion that we also need to move the AGM for the Uganda Society back to where it used to be. Whichever way you look at it, you cannot have an annual year and you're passing a budget in September if you're following the calendar year. It doesn't make sense. People don't have money to spend throughout the year, and you're passing it in September. Then what that has created also for the councils that have been coming in. Council for for Senior Council Bernard Owundo had to explain expenditures which were made by President Fiona Wall. President Semakade has to explain expenditures which were made by Bernard Owundo. So if we take back the annual general meeting where it should be, which I think used to be in April, around April, it gives people time to approve the budget and then spend it in that year. Okay? So yes, I agree with you entirely. If we can move together, we shall try next time to make sure that we have a joint AGM, because it makes sense. Start in the morning with ours, finish it, and then you have the annual general meeting for the Uganda Society, especially when the annual general meeting is happening on a day when there are no elections. Because when there's an election, you know what happens. It's a big meeting, and usually elections take up a lot of time. Otherwise, we have absolutely no problem with that. And we shall continue to report monthly to the council. We had already started giving those monthly reports. Christine, we will task you to always prompt Sandra to make sure that we give our quarterly reports to council, purposes of engaging with the members and giving them adequate information about the fund. So I think really that closes most of the questions which were raised. Continue the conversation, those of you who have not been able to talk, and we shall be responding to you. Thank you.
Thank you very much, members. At this very juncture, I want to recognize the presence of one of the legal minds that we always reach out to, Mr. Senior Advocate Francis Obo. Fred, I know, I think he's not standing because I always mistake his name for Mr. Frederick Ocheng Obo. He's one person we always reach out to. He's in the background helping us to direct us legally. Just a joke, senior advocate here promised to take us out as the board to a free go with senior advocate. So we need to know, we still need to know. Any member who can move a motion that we adopt the report as presented with the modifications. We have captured the proposals and the motion. We will share that in the minutes that we shall be sharing with you. Any member who can move a motion. Where's the microphone? I see Senior Counsel Bernard wants to move the motion to adopt the report. Thank you very much, Senior Counsel Bernard. Who is seconding the motion? I see Sheila, Miss Sheila, our Deputy CEO wants to. Oh, Christine. And there's a hand on the other side.
Thank you so much, the board and members. Senior Counsel Christine Nansov-Gamatovu. I second the motion to adopt the report with modifications. Thank you.
Thank you very much. Now we are moving into the finances. I know that a large part has been abstractly discussed, but we opted to have a financial analyst to do a financial accountant actually to do our management accounts. As you realize, we may not have presented audited accounts because we don't have an auditor yet, which will be the last item. IT team, our financial accountant is online, Mr. Samuel Odeke.
Yes, good afternoon. Good afternoon,
Good afternoon, sir.
board of the fund, that is the Healthcare and Benevolent Fund. My name is Samuel Odeke, and I'm the financial consultant at the moment. But behind me, I'm a retired banker. I think it's better I introduce myself before we go into the discussions of the account. I'm a retired banker of about 30 years experience in the banking industry, spanning over about 5 banks locally here, and occupy quite a number of senior positions. I was a corporate treasurer for Barclays, Bank of Africa, and then the Orient Bank, United Bank for Africa. Those are the 4 banks before I took up other positions. So my competencies are in financial management, financial analysis, corporate finance, and then treasury, as well as risk management. So I have also participated in starting two banks from Greenfield in the local market. United Bank for Africa was the executive director, and then I moved on to start a Commercial Bank of Africa as a CEO, MD, at the post that I left when NIC bought CBA to become NCBA now. So I'm contributing to my society by sharing my knowledge with the market, with the teams, and I currently work with a number of consultancy firms in different areas. I was given this assignment by the board chairperson because we work in another outfit together, which was also a startup. So she felt it that she needed me to set up some that is the foundation accounts for the fund. I want to show. Let me share my screen. I hope you are seeing that screen I've shared. Is it? I hope you are seeing it. Is it clear enough? So the brief I had was to provide draft accounts starting from the inception of the fund. I was told that the fund was established in July 2024, but it started operation.
Kindly zoom your presentation. It's on the lower pane.
Let me.
Yes.
Sorry. But are you seeing all the words?
Again, it's
Are you able to see? Are you able to see? I think that one should be fair enough. I think. To the benefit of everybody. Let me know if you are seeing it so that we share the
center it. That is better.
Is this better? You know, technology, when you start adjusting, when you are presenting, tends to disorganize you. So if you can be able to see, but at least my explanation should be able to, it should be able to give you the clarity of what I intend to share with you. I think I can get off the screen so that I can get off the video because of my network. So the brief I had was to establish accounts for the fund from the inception up to the end of the financial year. And I was given 30th of June as being the financial year of the fund. That's an established or agreed financial year of the fund for every operational year. And from September, since the operation started, I have prepared accounts up to 30th June 2025, which covers the period I'm going to summarize here below. Of course, the information I got was through the statement, bank statements that I was provided, and then the explanations that I got from Sandra, and also the explanations I got from the board chairperson, which helped me to form the draft accounts. These accounts are called from incomplete record. The draft accounts were prepared from incomplete record because there's no financial or a core accounting system for the fund as yet. Although there is I think there is a software which has been purchased by the fund to help in capturing the transactions of the fund and also to avoid manual interventions where there are so many sometimes mistakes. So in brief, I was given a brief that the revenue was going to mainly come from the contribution, not the subscriptions from the members. And I'm happy to hear that you have a membership of about 5,000 plus, which makes this fund to be, has a very good future and a very good solid base to continue with its operations and, of course, meeting its mandates. So straight away to the revenue, between 24, that is September 2024, up to 30th June this year, that is the last, the financial year, well, call it last financial year because it's last now. The fund received the 639 million being subscriptions from the members, and of which it spent about 20.4 million. When you are beginning, there is some small expenses, of course, others will come in later on, depending on how the need is on a needs basis. So that gave the fund a net revenue of 618 by the end of the financial year, 30th June. What does this mean to the fund? This is what we call the value of the fund. This is the net revenue, like in a commercial enterprise, which will be called net profit, which will go to retained earnings. But because this one is, I think, the fund is founded by, or is the shareholding by guarantee, I suppose. So we call it a reserve fund. On the balance sheet, since the inception of the fund, of course, the bulk of assets was cash. The fund was very liquid, with about 605 million in cash. Of course, they hadn't started the investment at that time. It was just beginning. So among us, there were some items which were purchased for the purpose of the operations of the fund, which included the office fittings, computer equipment, and also QuickBook accounting software. So that is basically what was used for that money in that period. And then, as I mentioned, the fund was very liquid, which considerations and decisions were made later on after the financial year to try to invest it into treasury bonds and into trusts. At this point, I would like to maybe advise the fund that, you need to have some other procedures, or not only procedures, but decisions on widening the asset allocation and also the choice of assets that you can be able to purchase, especially in light of maintaining liquidity, so that there is liquidity at the same time, excess liquidity can also get, what do I mean? Sometimes it's you can also invest in interbank. When you say fixed deposit, you put a fixed deposit of 3 months, and fixed deposit of 4 months. That's the money you'll be expecting to spend over that period. But at the same time, earning interest, because you should be hungry for income. This fund should be hungry for any earliest opportunity. So there were no vulnerabilities, no debts, no credits. So the fund, the value of 680 is by the end of 20 financial year. That is the 30th of June 2025. I think let me complete the presentation. Then question. So in the second part of the presentation, I will look at the management. Management accounts now cover the period after the financial year end. That is covering from July 2025. Last month just ended last week, but that is 30th November. Well, management accounts shows on a monthly the details of income and expenditure of the fund, which the board and management monitor, so that they can be able to see where the fights, whether they meet the budget. Or they will be able to make a budget after this, maybe using this management account. So management accounts are usually the ones that they use comparing actual performance against budget performance on a monthly basis for the fund. So this covers a period of 5 months. And on the income side, from July to November, the fund has received 311 million, being the subscriptions from members, of which 14 of the income. Among the income, apart from the subscription, the fund also received some interest from its investments in treasury bonds. It was a coupon investment, a coupon interest of 14 million. I think that's a good step. So these are kinds of the incomes that now help the fund to grow as it builds its base. So on the side of expenditure, there were quite a number of things that had to be spent on in order to now manage the operations of the fund, which are now increasing. The expenditure, of course, went up to 56 million. I don't want you to get alarmed by this comparison, because 56 and 17 million, because this is just the beginning of the fund. When every organization begins, comparisons will be spiking and going low, because the figures are absolute. You need to look at the absolute figure and what the expenses were relating to. So what caused the expense to go up? There are just a few things. Salaries. But this one is a normal expense. You don't need to have any issue about it, because this one is supposed to be incurred on a monthly basis for the people who are supporting the fund. But what I wanted to mention here is I saw erratic payments of salary. A salary for July would be paid in August paid in September. I think it's good for purposes of matching expenses and income for that particular period. You need to try to, as much as possible, pay the salary within the month that it relates to. The other expenses mainly were office and administrative expenses. Running the organization, running the fund. Of course, one of the payment was for the services that I provided, and then photo shoot. I know you have already read this. I didn't want to go through one by one, but the most important one you need to note is, of course, the website development. I think 50% or 60% was. This represents about 60% of the payment of the website development, whatever. social media. So the biggest expense was the cost of hiring a venue. Of course, this is the hotel or the premises that were used for the AGM board meeting which was held in November. So these are normal costs which are you expect to incur. The other costs which are as per mandate of the fund are typical healthcare expenses and then benevolence expenses, which are accounted to 7.5 and 12 million respectively, which is, I think, okay, because this is the mandate of the fund that I've heard you when you are talking, what you are trying to work for the members, how you are trying to address the members' issues, the key issues that affect your members. So that brings us to net operating revenue for that period to 255 million. That is in the last 5 months of the operation. And of course, this one will go to the member subscription reserve fund. This fund, that is now you are building the fund, that's building the value of the fund. When we look at the balance sheet, because it's just the beginning, no, things are not complex as yet. So you don't have a lot of items to discuss in here. Until as you grow, you get more maybe funders, you get more complex expenses, so many other things. So this was so clear. Cash in bank, it was 21 million. That was because the bulk of the liquidity had been invested in the treasury bonds, that is 629 million, and then also in unity trust, 225. So at this point, I want to mention to you, make a decision in here. I think the treasurer is there, the treasurer who is handling your investments. I think the board will be very much interested in seeing the maturity profile, like a table showing a maturity profile of each bond, and then also maybe each, and then the yields which relate to each investment, so that the members would appreciate the yields, the returns on their investment as more investments come in. And of course, as I mentioned, for purpose of liquidity, there's also a need to, so that you don't lose income on any redundant liquidity on the cash account. You can think of putting money on. Some banks even offer what they call call deposits. Call deposits can earn some interest income. I think 1%, 2%, 3%, or 5% is better than 0%. So that is the hunger I'm trying to, the hunger for income I'm trying to emphasize in here. Of course, during the last financial year, which ended in on 30th June, those items were bought: computer and furniture and fittings, and then accounting software. Those are the items that appear as your assets. That is why your money, the excess, not excess liquidity, but some of the cash for operational purposes, it was used to purchase those items to help in the operationalizing of the office. As I mentioned, the fund does not have any liabilities, and I believe that there will not be any liabilities. So I only want to mention here that accruals, I didn't have information enough or quickly enough to provide accruals. You would have seen that from the time you bought your bonds and unity trust, how much income have you accrued from the yields that are associated with them? How much have they accrued up the time of reporting? It also forms part of your income, though not yet earned, but this is what we are going to earn at this point of time. We know that this was what belonged to us, so that even if you were to terminate the investment at that point of time, you'll be able to get that similar amount of income. I decided to use this because the other report was very small on the other, this table, this statement of comprehensive income and also a financial position, which was speaking to what I was just telling you. On the other report, it looked very small, so I decided to separate them and then present them in this format. So I wanted you to have a look at this with the bigger. I hope you can easily see it from here. That from the income, this was the distribution, how the income was coming in and on which dates. And then expenditure, how the expenses were made and on which months. So like salaries, I say this salary was paid, salary for gas was paid in September, And then I think for September and October, we paid it at the same time. And then this was this is PAYE and the NSSF for this. That's okay because PAYE normally is given up the 15th of the next month to be paid. So this one can be accounted in the following month. So this is basically to show you the distribution of our expenditure was coming in or was going out during the course of the last 5 months. So this yellow part is what I've just talked about. That's the balance sheet, the assets, and liabilities. So on the issue of the management accounts, I think that is what I wanted to share with you. The last part, which I wanted to share with you, was key to note. As I started, I said these are draft accounts. The board AGM should always be looking at audited accounts. Since I've heard that you have selected, I think you're about to select an auditor, I think that will be very good. Because these draft accounts, I could not sign them because they are not part of assurance and probably, they need to be compliant with the accounting standards. Much as I've done them within accounting standards, but the auditors have that assurance, and they are given that assurance by the laws for the accountants. So the auditor will look at these draft accounts. They may have a discussion with me on the other areas and so forth, and then I'll be able to prepare for them, and then they will be able to make a proper report of the audited accounts that you will be normally discussing. The other issue is the QuickBooks accounting software. Once these accounts have been audited, I think I'll be able to help the person who is managing the software in the office to upload the opening balances, because those are audited balances that we want to start the financial accounting system with. So to upload those balances into the QuickBooks software so that whenever there are any transactions done, now everything will be put into the system immediately. So we shall avoid the delays of preparing the accounts. We shall avoid the errors that come in preparation of the accounts, and then it improves on the quality. And of course, the users of those accounts, they need the confidence. There's a lot of confidence because there will be many people you'll be engaging who will want to see your accounts. How can we have your accounts for a particular period? Maybe those ones who you intend to reach out to provide you support on some of the areas that I heard you talking about, the chairperson talking about, in order to help the membership. So I just made a clarification that these accounts were derived exclusively from banker statements of the fund, and of course the explanations from the manager and from the chairman of the board. That is what I wanted to explain to you. But you can now give me some feedback. Any clarifications or questions that you want to ask me about these accounts and the summaries I've made here.
Thank you. You can pull down your slide so that we see the last sentence on
Okay.
point.
Sure.
Yeah. Point 3 is not complete.
The information that was used to prepare this management accounts was derived exclusively from bank statements of ULS, healthcare, enhancement, and explanations from the manager of the fund. Why is it not complete?
We cannot see it. Just
Oh, you
scroll
could not
up.
see.
Yes.
Ah. Sorry. I had to make it smaller. That's maybe when you can see it, because on my laptop, it's very visible. Maybe I use another. Let me add open this.
It's okay. It's okay.
Is that clear?
Yes.
Okay. Thank you.
Thank you, Mr. Samuel. Members, that was the presentation on our management accounts. As you can realize, we have already made some money for you. We have a coupon. If you look at page 21, there's a breakdown of the investments we have made. one of the coupons on our CSDs has already paid 14 million. And our unit trust account manager, Mr. Collins, can also confirm that we are making money. So I think so far we have made around 21 million. Is it the position? 14 plus what we're making from the unit trust. Thank you very much. Any comments, feedback?
We'll go to the feedback. I just want to explain certain things. Some information we shall share with you on the maturity profile of each bond. We have got that information on slides, and also the interest expected to be accruing from each of those. We apologize that information was not able. We had a table, but we had some technical glitches and we couldn't upload it to show you how much has accrued from the investment, what is expected to be accrued. And yes, we agree with Mr. Odeke that information must be part and parcel of the financial statement. So we hope that when we get the internal auditor, the completed audited accounts will have this information. So we would like to bear with us. As soon as we get the audited accounts, we shall share with you and probably call an online meeting so that you can pass them in the normal course of what should have happened. Yes, we note that there are certain glitches in terms of the way we are managing our accounts. Our kickbook is not yet set up. Sometimes the salaries, as he has said, are paid late, which shouldn't happen. And that one, we promise that we shall correct that so that we don't have those glitches in terms of our accountability. Accruals, yes, I talked about accruals. And these are management accounts, so we don't expect them to be adopted, but maybe to be received so that we can then wait for the audited accounts when you now appoint the auditor, which is going to be the next item and final item on the agenda. So let's see if there are any comments from Mr. Samuel, and then we'll move forward. Thank you.
Any comments online? Members seem to be satisfied by our financial performance. There's a hand. Mr. Pandey. No. Just shook his head. Name and comment, question, or feedback.
Thank you so much. David Amanya is my name. And the chairperson touched a little bit of what I wanted to seek clarification on, particularly on the aspect of the salaries, because prior to the presentation of the financial analyst, we were told, or we were informed that for now, the board is still managing the fund on pro bono basis. And yet we saw some of the expenses, including salaries. So maybe you can clarify that for the members to understand why it is a part of that, or where that information would have arisen from for the financial analyst to capture it, yet he mentions that it came from the board.
Actually, it came from the finances. It's not from the board.
Yes, but I think what they're asking somewhere is whether specific question, because we say that we're not earning allowances. So he's wondering whether expense is coming from and to whom are you paying salaries for? That's what he's asking, isn't it? I think that's what he wants to know. So, Samuel, can you please answer? Because otherwise
No, I think, thank you for I will answer it and then you will close it. Because every organization like starting up, you need some people to assist you. Much as the board has decided to take it on a pro bono basis, but you cannot get some people outside to work on pro bono basis. That's why Odeke Samuel was paid 3 million because Odeke is not working on a pro bono basis. So I think, and I think it's only one person who's in the office who's helping to manage the office issues and things and other things for their fund. that is getting that payment. Actually, that's what I established. I think this salary is for just Sandra, one person. So I think it would be good to really always have somebody in the office who runs up and down and also to remunerate that person for that work that they do in the office. That's why you saw that salary there. But as far as the board is concerned, from the information I have and the accounts I got, there is no payment to any board member, not even any allowance.
Okay, thank you, Samuel. What's your name again?
David Amanya.
David Amanya. We have one salaried officer as of now, and that is that lady there, Sandra Amanya. So the rest, for us, we have not started giving ourselves allowances, as I mentioned. 2026, we may start giving ourselves allowances because we're waiting to first earn our way. And now that we've vested the money, we're beginning to see that we're earning our way. We're now going to look and say, okay, what is the optimal allowance that we can earn, given the nature of the business we are in? This is a benevolent business, so we must also craft our board costs with that at the back of our minds. Yeah, and again, we are going to also mirror probably with what the society is paying at the moment.
Madam Chairperson, you promised that we shall have audited books at a later stage. Is that right?
Yes.
So now that leaves this report. It has saved the several questions we would have, because maybe the other report would be in position to address them.
Yeah.
But the most pertinent one, where unfortunately the CEO and the treasurer are here, is seeing an item of 10 million at a certain page under expenses. 10 million being cost of hiring the venue for the AGM board meeting last November. I don't know whether it is a typo or you are referring to this venue here.
Was it in November? Where is it in November?
Just below the salaries, item 2, part 2.
I think there's a type. Yeah, okay.
Go to part 2.
Yes.
The report is not numbered.
No. That is an error. And we apologize for that. Samuel, can you, I think it's an error. We never held any meeting.
No, the 10 point, I think the explanation I got from, because this was an explanation I got from Sandra, or maybe there was a mistake in it. So maybe this money is a provision for the meeting of today. I don't know, but that cost appeared in the statement that had been spent.
Yeah, it couldn't have been last November.
Okay.
That's an error.
Maybe the period is, you'll guide on the period. May not be November, but
okay, last November, meaning last November 2025, because November has just passed. Okay, so this was preparation for this meeting.
I have the details.
Can I throw some background for Mr. Pandi?
Okay.
Initially, we wanted to have this in November. Well, sorry. Wanted to have this meeting in November, then we had to shift it because of we had other issues that constrained our holding it in November. So we shifted it, but we shall correct it, and when we get the audited accounts, that shall be clarified.
So, like you have stated that it is for today.
Yeah, this is the one today.
I hope I am safe, but what I wanted to mention is that at ULS House, where I want to emphasize that we pay for ULS House. There is a hall which is even bigger than this. I would know why. Did you make any efforts to request ULS to give you that space? Because the other time I was there for the ULS debate, it looked available. I don't know whether today it had other engagements. Why did we opt to pay for space of this size for 10 million, yet we would maintain that fund? If we had engaged the ULS, did you engage? Did they refuse, or the room was not available?
None of the above.
So I propose,
because as you know very well, that even the ULS itself sometimes opts out of, last time we were in, where did you go? We went to Chigo. We were in Chigo? No, we were in Mestiu. ULS, we had a meeting in West. You remember? The meeting where we said we are only here. It's a training meeting, a CRE meeting, and it's not you remember that one. So sometimes, much as there's that space, we are not yet, but as we said, going forward, we shall be looking at all these issues and we shall make sure that we use the chips. But also, you remember that the space there for parking is also not adequate. Yeah, there's little space for parking. So when you tell lawyers to park in the space that is there and they have to pay, then they will start making noise. You know, us lawyers, you know, you say, but you know, because the parking next door is it's for pay parking. You don't get it free.
There's a parking after a certain law firm.
Yes,
There's
I know
there.
that. Yes, but you pay.
Yeah. So members would be given an opportunity, because if I come and I know I'm supposed to pay for parking, it will be easier than the 10 million. But I'm not condemning you. I was just bringing it up that as a starting fund,
it's well taken,
where we are looking at using cost-effective means to save the fund. The 11 million, like I said, it will be broken down to know whether it is a lump sum for a month, it is a lump sum for a year. Otherwise, for that, I have no issue with this report because it has been explained and you have tried to explain the use of the money which you received.
Okay.
We shall audit you very well next time when there is some big amount of money which we see not tallying.
Okay.
But for now, like you have said, I want to thank you and your team.
Thank you.
Because this is the transparency that we want.
Thank you.
If you don't explain, then we shall assume the body is eating our. Thank you very much.
Yeah, one other thing I wanted to assure you, Mr. Pandan, thank you very much for those comments, by the way, they are very important. Is this cost of the venue includes the food and everything that we've had here? It's a total cost. We had to come here and negotiate it. But yes, point taken, we shall try to make sure that next time we look at the most cost-effective way and most, yeah. So can you please help us move a motion to adopt these management accounts, to receive, sorry, not adopt, to receive management accounts. Thank you.
Mic. Someone moving the mic. We need a motion to receive the, thank you, Your Worship.
Madam Chair, I would like to propose with a very slight amendment that we adopt them as part of the annual report. The annual report has some summaries about the accounts, but this cannot be adopted separate of the annual report. This is part of you explaining to us what you've been doing. I'd like to move a motion that they be adopted as part of the annual report.
Thank you very much. Any member to second?
Sila Isata, I second.
In a very short while, we are going to move to our next, we are moving to our next item. Thank you for that.
Chairman, maybe for clarification, before I get out, that 10.8 million was paid to Elegant Terrace Hotel Limited. I don't know for what purpose. Maybe I just put AGM for something, but it was paid to Elegant Terrace Hotel. You had a meeting there, I think.
No, it is here. It has been clarified. It has been clarified.
Okay, good. Thank you. Thank you.
The room is Elgon Terrace. Yeah.
Thank you. Thank you.
The next item will be a presentation of the appointment of the external auditor.
Colleagues and ladies and gentlemen, I'm sorry this has taken long, but this is the last leg. Be patient with us. This is a paper presenting the external auditor for approval at this meeting. the next person who's going to audit our accounts and whom we hope we shall present a report to you as soon as possible, at least for the financial year that we have just ended. This paper presents the board's recommendation for the appointment of a company called Springs and 2J Associates LLP. Is the representative here? Where is the representative? 2J. Yes, please, can you move forward? And they are going to audit us for the financial years 2024 to 2025 and 2025-2026. Because we're already now in 2025-2026. So we were established to manage contributions and welfare resources with the highest standards of accountability. The appointment of an independent, competent, and reputable auditor is essential to maintaining stakeholder confidence and safeguarding the integrity of our financial reporting. Therefore, in line with the Memorandum of Articles of Association and the board's fiduciary duty and applicable legal and professional requirements, the board now seeks the approval of the annual general meeting for the proposed appointment. What did we do in choosing the service providers? Because of the time that we were looking at, sometimes we would use sourcing methods, but when we do, we bring these people to compete with other people. So in this particular case, you can have a seat in the meantime, madam. We had 5 accredited audit firms who were recommended to us by the Association of External Audit, what do you call it? ISPAO, who recommended to us the companies, and then we approach them to send their profiles. We take them through an exercise. We looked at them and then we graded them, and Springs and 2J Associates LLP came out top. Why? Because of their previous work in areas that are similar to what we are doing. We looked at them. They have got 14 years, I believe, in a work similar to what we are looking for. And then they have worked in not-for-profit membership-based welfare and trust fund sectors and circles. And then they have deep expertise in audits involving member contributions, benefits disbursement, reserve funds, investment portfolios, and internal controls. This is what attracted us to this particular group of people. There were others who were equally good, but these people had an edge over others because their areas were similar to what we are trying to do. And they have demonstrated capability to deliver high-quality audits with tight reporting timelines be presented to us. So we hope that by engaging this team, we shall be able to do what we should have done before this AGM and to present to you the audited accounts as soon as possible once they have taken over the office of our external auditors. So they are going to do the audit and annual financial statements of the fund in accordance with international standards, evaluate internal controls. They will evaluate us whether our internal controls are in place and they are functional and effective. And then, of course, issue an independent audit opinion as to the validity of the accounts, which we should have included in this annual report, which we will include in the next annual report. And of course, engage us as a board and also you members. We are required to present audit accounts and answer any queries. So we've agreed a fee for them to. We've agreed a fee. I think. Do you know the fee that we agreed? I don't have it here, but we agreed a fee of 4.5 million shillings, net of taxes, and then so we assess this fee against other people and the time they wanted to take, and we consider this the most optimal amount we could pay for the kind of work we wanted. There were others who had much higher figures, almost 3 times, 4 times as much as they gave us. So the recommendation here is that based on the evaluation undertaken, the board of directors of the fund recommends the appointment of Springs and 2J Associates LLP as the external auditors for the fund for the financial years 2024-2025 and 2025-2026. Ordinarily, you appoint an auditor for about 3 years. But we said, let's give them these 2 years, and then we shall extend for one more year, after which we shall now change, as is the practice, to another firm The AGM is requested to approve this appointment and authorize the board to finalize the engagement, terms, and fees. I thank you.
Members, the mic, please.
Madam Chairperson, thank you for the presentation. You've talked about Springs and 2J Associates. Do we have a lead auditor, or we just simply appointed an audit firm?
There is a lead auditor, and let the lady, I think, speak to that. Sorry, I should have done that.
Maybe she can also tell us
Okay.
about herself, if she's the lead auditor, her experience, so that we are informed and we don't go back and say, but you were there when we were appointing this lady. Why are you now criticizing her?
Thank you very much, Mr. Pandey. Thank you very much. Sorry, I had made that omission. She should have had present herself and talk about the lead person who is going to be answerable, and whether that lead person, the partner's person, is qualified to do the work. Thank you.
Good afternoon, ladies and gentlemen. Thank you. My name is Maria Nabanja Sentam, the managing partner, Springs and 2J Associates LLP. This is a partnership of 4 partners, 2 ladies and 2 gentlemen. It is a merger, actually, whereby our experience differs. That the 2 merged partnerships had an experience of over 14 years, and some of the organizations, some of our clients are similar to what we intend, actually, what we're driving to do. So we believe we can move as a team, and all of us reach where we want to be. You've talked of the retirement benefit scheme. We have that experience, and we have a team. We have the software, and we are ready to work with you so that we reach heights. Thank you so much. Unless there are questions, but that is us. Sorry, I'll be the lead. I'll be the lead, the managing partner, and alongside me is my Dr. Michael Tujetwena to handle the exercise. Okay. I've been requested to share our profile. We shall share it again for distribution. I think to summarize who we are. Thank you.
We have this profile and we looked at it closely, but we shall share it again for purposes of members' satisfaction that we did a good job in choosing these people that we chose. And the report of how we got to this point is also available for if those who want to look at it.
Members, we are closing. Any member to move a motion that the AGM appoints Springs and 2J LLP as our external auditors for 2 years. Our member, Arthur Isiko, I see your hands, and you are the treasurer. So move a motion that will bite you.
Thank you so much, Madam Chair Person.
Thank you.
I have heard and I have read information concerning Springs and 2J. I hereby recommend and move a motion that they are appointed as auditors for the next 2 years.
Thank you. Any member to second? any member to second the motion to appoint Springs and Tuje to be our there's a hand. All right, thank you.
Tuliam Sima Geoffrey, and I second.
Thank you very much. So our appointed auditors for 2 years will be Springs and Tuje, LLP. Thank you very much. We are going to have our closing remarks from our chairperson to close this session. We have partners that we will recognize in a special way. We have moved with some of these partners from when we started. DFCU Bank is one of those partners that started by disturbing us, but then we got along the way. Then Bank of Uganda did not send a representative, but we are that trusted that we have a partnership with Bank of Uganda. Chair.
Thank you very much. I'm going to stand for purposes of getting some respite. And I'm sorry when I stand, there's something that I do which you won't like, but I'm going to do it because you cannot see me here. So that my leg should not be bothered. But thank you so much, those of you who have stayed the course, and for your support, and for all the comments that you've given us since morning. And I also thank our colleagues online for staying the course and being with us throughout this time. We know that without you, we cannot exist. You are very important members of this organization, and we treasure your contributions. Every single contribution that has been made here will be taken and considered, and then we shall give you feedback. I know some of them cannot be resolved immediately because of reasons which we know very well. But I want to assure you that we're working very well with the Uganda Society, and that's why the Secretariat is here, and that's why the president of the Uganda Society, represented by Mr. Council Arthur Isiko, is also here. So we thank our partners, Britam, DFCU, Asset Management Company, DFCU, Rhodium Hospital. We shall soon be introducing Rhodium Hospital so that you can meet them. They do a lot of work in the space of mental health and depression and all those things related to that. Dr. Lindsay, who was here earlier, also has got an outfit for counseling. So we will also be partnering with her association and La Paire. And I think the gentlemen who were here earlier to tell us about Eden Fitness. I think those are the people that we are going to be looking at. So I don't have much to say except to express my and to welcome you, please, on our team, and to be happy that now we are going to be a little bit better than what we've been. Mr. Pande, we assure you that the audit accounts will be audited, and all those little nitty-gritties which you are still questioning will be streamlined to your satisfaction. And we thank you very much for your intuitive and very inquisitive contribution to this discussion. So I think without much ado, I'd like to close this annual general meeting, and to once again thank you all very much. Our partners, please let's clap for them. They have stayed here with us the whole day. So thank you very, very much for coming and for being here. I know there are many questions. Why did you rent a hotel? Why didn't you rent a hotel? But by the time you make this decision, you've fought through all the possibilities. But as the vice president said, Mr. Anthony Isiko, Mr. Arthur Isiko, when we now hold the meeting together, you now also understand that probably even the rooms that we have may not even be enough for us to sit, much as it was a good idea to have those rooms there. So the next probably meeting we shall have will be an extraordinary general meeting to pass the accounts, to pass the audited accounts, and it will probably be online. And then a few of us will be sitting at the Uganda Law Society, as has been proposed by our friend, Mr. Pande. Thank you very, very much, and may God bless you. We need a closing prayer. Who's going to pray for us? Dr. Kito is our priest.
bow our heads and pray. Dear Lord, we thank you so much for today. We thank you for the deliberations that we've had concerning the Uganda Law Society Healthcare and Benevolent Fund. Lord, we pray that you guide this fund to great heights so that we can support and serve our members in their times of need. Lord, I pray that you build up, that you continue leading the board, that you continue blessing the members to pay up, and that you bless the ULS Secretariat for the partnership and the different partners that have been here. And as we depart, we pray that your blessing rests upon us, upon our members who are not well, upon our members who are grieving, upon our members who are in need of mental health care and self-care wellness. That, Lord, you continue guiding us. I pray all this through your mighty name. In Jesus' name I pray. Amen.
Thank you all. We would have one stanza of the national anthems. To our partners, we are 7,713 members, so be sure that you'll get business. We'll be involving you in our talks so that you can talk to the memberships. IT, can we play the national anthems in reverse order? Thank you.
Recording stopped.